Hello, 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 hello. Hello, my friends. How are you doing today? Get my stream set up here. Here we go. We got Facebook set up. Yes, we do. Got YouTube set up. Got to turn on this computer. It's not easy to set up a national support group meeting, let me tell you. All right. Hello, 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 my friends. My name is Jill Osborne. I am the president and founder of the Interstitial Cystitis Network. It is Sunday, March 21st. It is time for another IC support group meeting. And oh my God, I have got some really interesting news to share. I'm quite excited. We now understand why some of us, myself included, end up with other conditions. And so I'm going to go through that with you guys. Here, hold on a sec. Oh, last night at 1 a.m, I got the last part of my magazine to our typesetter for our Spring IC Optimist magazine. Hello, you guys. Hello. Hold on. I need to open this article because I'm going to talk about this article I just wrote. Spring. There it is. Perfect. All right. Let me introduce myself. Interstitial Cystitis Network. I'm the longest serving IC states, and at this point in time, probably in the world. Not sure about Germany. They still might be having some meetings. Haven't heard from them in a while. Hello, Donna. Hi, Shirley. Hello, Ann. The purpose of my doing these meetings is to make you so strong, so knowledgeable, so informed that no one can mess with you again. Right? We don't want anybody telling you that IC is all in your head. We don't want anybody telling you that this is a figment of your imagination, because we've got some pretty exciting news to share. We don't want anybody minimizing you, demeaning you, telling you that there's no treatments, because that's simply not true. However, it is important that you understand that we no longer think of IC as a bladder disease. And we haven't for about a decade. Honestly, we haven't since about 2008. Why? Hello, Rocky. Hi, Pamela. Hello, Stephanie. Hi, DJ. Hi, Brenda. Hi, Shell. Hello, Kathy from Texas. Nice to see you. Lauren says, has anybody had a flare due to the COVID vaccine? A small number of patients do have a flare, but when compared to the risk of getting COVID itself, including COVID potentially actually in your bladder wall, you have to weigh the pros and cons. We're doing the only IC study, IC COVID study. And our study of more than 100 patients show that 75% of patients who actually get COVID infections have flares, and 25% have very, very severe flares. We think the reason why is because COVID is infecting their bladder wall. That's our guess. Why do I say that? Because we have 14 studies now that have found active COVID virus in the urine of IC patients. We have 4 studies which show the active infection in the kidneys. So it's not a long stretch to imagine that the virus could actually infect the bladder wall. So for those 25% of IC patients who report severe symptoms with a COVID infection and their typical therapies and their typical rescues don't work, we think that that's because they probably have COVID in their bladder. The good news is that after a period of time, that does seem to diminish, because the virus does eventually die, we hope. So again, you compare that with the risk of having a week-long maybe flare or a couple-day flare just because you've had the vaccine. I think I take the risk of the vaccine over the risk of the actual infection, right? But out here in California, we still can't I can't get my vaccine yet. The vaccine distribution has been very slow. So we're still hunkering down in our homes. Hello, Beatrix. Hello, Emma from the United Kingdom. Hello, Shannon. Hello, David. Stephanie says, does anxiety bring on flares? Sure, it does. Because when you're anxious, there are 2 fundamental things that happen. The fight or flight response, right? So what does the fight or flight response do? It triggers muscle tension. So you will subconsciously tighten your pelvic floor, and that's going to cause a flare. And then the second thing that happens is that when you're anxious, and you're in pain, your body, in your brain is trying to understand why you're in pain and goes, uh-oh, you're anxious. So it's going to intensify that pain because your fight or flight response thinks your life is at stake. So pain that is accompanied by anxiety will be intensified by the midbrain. Pain that is accompanied by laughter will be minimized by the midbrain. Tanya says, "Thank you for support. You gave me advice 14 days ago. Good advice. I have Candida albicans. Greeting from Belgium. Oh, good. I'm so glad they caught that." Arlene says she had both vaccines. They didn't affect her bladder at all. Hello, Clifton. Hi, Stephanie. Hi, Lorraine. Hi, Debbie. Ann says, "Can you have IC as a child?" Sure. The youngest patient I've worked with is 3 years old. 3 years old. That was a young boy. And again, remember we have subtypes, right? Not everybody's the same. And so we're going to be, and this ties nicely into what I'm going to be talking about to you next. We have to think injury. So could that child have been injured? Could they have fallen on their tailbone, had a little bicycle accident, or could they tragically have been abused? That would be it. The second thing that we would look at, honestly, is, and this is going to sound wonky, but when I was 32 years old and I was referred to UC San Francisco for my IC, one of the very first questions the doctor asked me was, "Were you a bedwetter?" I went, not particularly, maybe a little tiny bit when I was extremely young. And he explained that sometimes children who are bedwetters become incredibly stressed because of parental reaction and parental response. So imagine being a child and you're asleep and you wet the bed and your mother screams at you and hits you and beats you, which some mothers do or fathers do. Of course, that child is going to enter extreme fight or flight. They're going to clamp down on that pelvic floor, which is going to cause some issues. Sorry, this is allergies. That's all. This cough. Shell says, "I just saw something about eosinophilic cystitis. I have eosinophilic esophagitis, and my pulmonologist suspects that my asthma is eosinophilic as well. Can my IC possibly be related to this?" Yes, Shell, we have a condition called eosinophilic cystitis, and it's tested through a biopsy. And what they do is they look for an abundance of eosinophils or white blood cells in your bladder wall. So that would be done through a biopsy. I have a section on our website, icnetwork.org, dedicated to eosinophilic cystitis as well as radiation cystitis and all sorts of stuff. So go on over there. We do the only eosinophilic cystitis support in the United States that I'm aware of. Generally, I will just say so eosinophilic cystitis means that somebody has an abundance of white blood cells and eosinophils in their bladder wall. And of course, your body mobilizes white blood cells to tissue under threat, right? And so, eosinophils and white blood cells are your body's way of fighting off any issue, any problem that might be happening. And so these tissues become flooded with eosinophils. The most memorable person that I worked with, Shell, was a mother who lived in rural, like Indiana, somewhere in there, Illinois, somewhere in there, who was on a well, and her children had eosinophilic cystitis, and they were able to trace it back to contaminated well water that had been contaminated with something from a neighboring farm. And so, man, if you're in West Virginia, if you're in some of these states where there's a lot of coal mining, a lot of farming, industrial strength farming, industrial strength chemical exposure, especially with what they did to minimize and reduce the Clean Water Act in the last administration, we always want to look at water quality. All right. So Shell, that would be something that I would, most cities will come and test your water. They will, because it could be a storage tank. It could be an issue with storage. It could be anything. But if you're on well water, or even if you're on city water, you should ask them to come test your water. They usually will do that for free, just out of curiosity. Thank you. Mia, it's my one claim to fame my one hobby is I love earrings. Here, hold on a sec. I'm broadcasting.
Where is the pad for your mother?
They're right next to, there should be one hanging on the mirror.
Why isn't it on the bed?
Oh, you mean the pink pad? I don't know. Did she take it off? They should be on the little side cable right there. Sorry. Hey, man. That's life when you care for a 98-year-old and a 92-year-old. Let me tell you, it's hard. All right. Jamie says 3 weeks post-COVID and my IC is terrible. My doctor says its inflammation will eventually go away. Offered no guidance. Jamie, that's exactly what other patients report. You got to write it out, girl. You got to write it out. Pamela says, thanks. I was a bedwetter from young days because of epilepsy. Yeah. Okay. All right. Hello, WSM. So, you guys, I'm simulcasting live on Facebook and YouTube. If I'm looking up here, I'm looking at Facebook. If I'm looking down here, I'm looking at YouTube. YouTube says, I have hunters getting ready for another fulguration this Thursday. Last time I had this procedure, I did not get any positive results. I will ask for bladder pics. So, WSM, the other thing you might want to ask for is, how about an injection of a steroid directly into the lesion after they fulgurize it? Get a steroid in there. That's a triamcinolone is a classic therapy for IC, and many doctors will combine the two, fulguration with a triamcinolone steroid injection, and that will help calm things down. So WSM, going over to our website, icnetwork.org, go to the treatment area, go to the Hunter's lesion treatment area, and you can get the data on that. All right. Oh, and let me just start this out by saying we are having a secret sale on the IC Network website, 15% off. Everything, supplements, everything, and I only announced it by mail to people who signed up for sale notices. It's not a public announcement other than now. So if y'all want to get 50, it's really rare that we do a sale because our prices are already so low. They're like massively reduced. 15% off. Spring 15 is the coupon code. Write that down. Spring 15 for the next week. Okay. So this is how I do these support group meetings. I always do, or I try to do, a 30-minute, 45-minute lecture. Take your questions. We transition over to Zoom. We'll do a Zoom meeting where you can come in and ask me questions, and then we come back to Facebook and YouTube, but they'll all be on at the same time. But I have something really, really important to talk about. This book is a fantastic book, Facing Pelvic Pain. And I become very, very good friends with a urologist at Harvard who asked me to contribute a chapter to this. It was a very wonderful invitation on her part. This is the book that you want to get if you don't understand what the hell's going on. Like, your bladder's normal, bladder therapies don't work, you're still suffering with frequency, urgency, pressure, pain, maybe some other unusual symptoms like pain when sitting that is really relieved by standing, whatever. This is the book that will go over every potential condition. Every potential condition. It could be a skeletal muscle issue. It could be a reproductive issue. For men, it could be a specific issue related to their anatomy. It could be a rheumatological issue. It could be an infectious issue, all that sort of stuff. You guys, seriously, the book is freaking free on Kindle Unlimited. You have to be able to walk into your doctor's office so knowledgeable, so informed that you can ask the right questions. You cannot expect them at this point in time to be up on all of this. It's really rare to find a pelvic pain specialist and an IC specialist in the United States, if not in the world right now. There's a handful. So you have to be prepared to come in and talk about your anatomy, talk about your symptoms, and say, what about this? What about this? What about this? Right? Got to rule stuff out. Because my heart, I was talking to her yesterday. I'm buffering on YouTube. Huh, that's weird. That's rare. Okay. So, the big story last fall was chronic overlapping pain conditions and central sensitization, right? Okay. So why do some of us, not all of us, but some of us get IC, vulvodynia, irritable bowel, fibromyalgia, TMJ, sensitive skin, all that sort of stuff, right? I'm in that group. I mean, I'm absolutely in that group. And it's really characterized by super sensitive skin. That's one of the hallmarks that we look for. Super sensitive skin or a wicked sense of smell. Those are classic symptoms of what we call central sensitization. Anne is saying she requested the free book. Haven't sent them out yet because I'm giving it a couple more days because I'm asking Twitter people to do it too, hon. But they'll go out this week for sure. Okay, so what the research study showed is that we have a nervous system that is become remarkably sensitive. The entire central nervous system, not just the nerves in the bladder, but also the nerves in the bowel, and even the nerves in the skin. And we also know from brain scans for chronic overlapping pain conditions and IC patients and vulvodynia patients and IBS patients that our brains are kind of functioning in fight or flight. In fact, we're kind of stuck in fight or flight. There's a part of your brain that's turning on, that's only supposed to be on when you're under stress, like facing a saber-tooth tiger or if your life is at stake. And then normally that turns off. That's the sympathetic nervous system. So if you open your front door, you see a saber-tooth tiger, you can darn well bet you're going to get startled. Your sympathetic nervous system is going to take over. It's going to prepare you to fight for your life or run for your life. So it's going to raise your blood pressure. It's going to raise your heart rate. It's going to tighten your muscles, right? But normally that turns off fairly quickly and the parasympathetic nervous system takes over. And the parasympathetic nervous system calms everything down. It reduces your blood pressure. It reduces your heart rate. It relaxes your muscles. So, and we know, here's one thing we know for sure is anxiety is a big deal. Anxiety is a big deal for us, for a lot of us. I mean, I had wicked anxiety, as a teenager and into my 20s. Cindy says, I'm always in fight or flight. Anne says, I have frequency, urgency, no pain. Why? Because, girl, only your frequency, urgency nerves are turned on. Your pain nerve is not turned on. You only have two nerve groups in your bladder, alpha afferent nerves for frequency, urgency, and the C fiber for pain. The blessing in your case is your alpha afferent nerves are turned on, but your C fibers are not turned on. That's a great thing to be in. That's a great place to be in. But the problem is that the nerves are still irritated. Okay, so we know that some of us have a central nervous system nerve sensitivity issue, and that's a given. No shame, no blame. Y'all didn't cause this. It's not your fault. It is in some cases genetics. Hello, redhead, Norway, makes total sense for me. And for others, nerves get injured or turned on. So the new thing that I'm going to talk to you about today is something called small fiber polyneuropathy. So we learned this 2 years ago, that a small think about your nervous system for a moment. Your nervous system comes in all shapes and sizes. You got big nerves and you got little tiny nerves. A small fiber nerve is the nerves with the smallest diameter. These are teeny tiny nerves. And they're the nerves that are in the surface of your skin. They're the nerves that communicate heat. If you put your hand on something hot, the small fibers in your hand immediately go, uh-oh, and they send the heat message to your spinal cord and to your brain. They also are dominantly involved with pain. And so if something is happening on your skin, then the small fiber is going to be triggered and send that pain message to the spinal cord. So small fiber polyneuropathy is fascinating because guess what? One of the latest research studies found that 66% of pelvic pain patients and patients with IC and IBS and vulvodynia, 66% of us have small fiber polyneuropathy. So what the hell is that? Well, first of all, how do you see it? It's great news because you know how they test for it? They do a skin biopsy off of your leg, 3 millimeters. All they need to do is look at the skin on your leg, at your lower leg. And there's a very specific way that the nerves look. And so think about I want you to think about this for a moment. What is the number one problem we have? Doctors don't believe us. Think about the fibromyalgia patient. Man, you're tired, you've got random pain throughout your body, and the doctor's going, I don't know if I believe in that. Now we have an objective measure, an objective test. They can do a skin biopsy and prove that you have it. And in this latest study, 66% of us had it. I have it. I am 100% sure that I have it. Why? Because when I go to bed sometime, I mean, my skin is my hot button. Man, I have to wear cotton. Hello, what do I always wear when I do these meetings? Is a cotton t-shirt, right? I can't wear any polyester. I can't wear any textures. Even the seams. I even have the seams taped down. See, look at that. There's tape there because the nerves in my arm get irritated by seams. And sometimes when I go to bed, I get random pinpricks in weird spots in my body for no reason. Like I'm literally laying in bed, my eyes closed, trying to go to sleep, and something pricks me down on my lower shin, or in my there's one spot right in my back, right. And so I always have a big tin of CeraVe and CeraVe Itch Relief next to my bed, and as soon as I feel that itch, I grab it, I slap it on there, right. There are other symptoms of polyneuropathy. So, um, actually, before we even go there, let me make sure so I just wrote a big article on it. So think about this for a moment. A tangible, objective analysis of a small piece of skin could confirm nerve abnormalities and explain why a patient may be struggling with pain. This could revolutionize diagnostic methods and, more importantly, provide proof that a patient has a nerve dysfunction. Do you need evidence for disability application? The biopsy results could speak volumes about why you are suffering from IC, IBS, and other painful conditions. Better yet, this data will absolutely destroy anyone who suggests that pain is all in your head. No, it could be in how the small fibers in your nervous system are functioning. Let's see. So small fibers are found in abundance in your skin. When they are damaged or malfunctioning, patients experience a heightened pain sensation. So, for somebody with a normal nervous system, you could pinch their skin and they probably wouldn't even bother them. But for people with a more sensitive nervous system, you could just touch their skin and it would bother them. That's an example of a heightened pain sensation. But here's the deal. We also have small fibers in our bladder and in our bowel and in our other organs. And so the question then is, are the small fibers in our bladder wall also more sensitive? And the answer is yes. Here, hold on one sec. Yeah? Okay. I don't know what you mean. Is she?
She's out in the shower.
Okay. Okay, great. Thank you. So, and if you think about classic IC symptoms, so let's just say that if you've got a sensitized nerve in your bladder wall, you've got a neuropathy, a small fiber neuropathy in your bladder wall, that means that nerve is easier to trigger. And what's one of the common symptoms of IC is feeling full even when you're empty. Like your bladder feels really, 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 really full, but you go to the bathroom and there's just nothing there. You pee out a teaspoon and you're like, what the hell? It feels so full. That is an example of a nerve that is giving you more pain than it should be giving you, or giving you more sensation than it should be giving you. So, what causes a nerve to malfunction like this? Well, sometimes it's an injury. Sometimes It's genetic. Shelley says, I saw a neurologist years ago before we moved. He told me pain and random itching are related. He said it's just the way your body reads a message. Well, we're going to expand that. All right. So why does it happen? It can happen because of an injury. It can happen because of some genetics. Hello, redhead. It can happen with some diseases, like if you have untreated diabetes, if you're an alcoholic, those can damage nerves and cause a neuropathy. If you have a untreated thyroid dysfunction, and I was diagnosed with low thyroid back in my early 20s, that can cause a neuropathy. An autoimmune disease like Sjogren's syndrome or rheumatoid arthritis can be linked to some small fiber neuropathies. But the other thing that will absolutely cause a neuropathy is a B12 deficiency. How many of you have discovered that you're super low in B12? When I talk to IC patients, I'm going to say at least half of you report extremely low B12 levels. B12 is an essential vitamin for nerve function. And so again, for me, 10 years ago, I was extremely low in B12 and vitamin D. And they put me on supplements, but sometimes I forget to take the supplements and I can forget them for months. And then my skin starts getting more sensitive and I got to take it again. And I'm absolutely convinced that that B12 deficiency as we get older is certainly playing a role for some of us. Noelle says, could my 43 years of type 1 diabetes cause my IC? I'm 51. Well, we're talking about nerves. We're talking about nerves, that nerves become more sensitive. Some chemicals can trigger neuropathies, like chemotherapy. So we have something called chemocystitis, patients who get symptoms of IC after chemotherapy. So this could be happening to them. Or if you have been exposed to heavy metals, mercury, that could be it. And unfortunately, some antibiotics that are commonly given to us, like nitrofurantoin, are also triggered with neuropathies. Like I took one Bactrim DS and my ears started ringing and they've never stopped. One. That one pill damaged my ears and gave me ear ringing, gave me tinnitus. And also, we know that viral infections can cause a neuropathy, specifically Lyme disease and herpes, chickenpox, shingles, HIV. If you've ever had there are some patients who have post-herpetic pain syndrome, which is basically a neuropathy of the nerves where the herpes outbreak was. I actually have one very, very dear friend diagnosed with IC, and all this time it was a post-herpetic pain issue. So we know nerves can be injured, just like you can break a bone. And in fact, when you usually do break a bone, you usually damage the bone, you usually damage the muscles, and you usually also damage the nerves. So the nerves in our body are fragile. They're fragile. They can be broken too. Lorraine says, I had my vitamin D levels tested. They came back normal. How would I know if I have low B12? They have to check for B12. They need to do a blood test for B12. And there's been a research team that has been working for years now on a variant of porphyria. Porphyria is a condition where there's a vitamin B12 processing disorder. And they believe that some patients with IC have this B12 processing disorder, and this supports that. And we'll have more on this later this year. That's something that we've talked about before, but it's kind of an arcane, obscure line of research that's been happening for quite some time. So what are the symptoms of a neuropathy? If you have a neuropathy in your skin, you can have tingling, pins and needles, burning pain, electrical pain, cold light. So it can be cold or it can be hot pain. It can be generalized pain. You might even feel like you're walking and there's sand in your shoe, or there's a rock in your sock when you're trying to walk. That's an example of a small fiber neuropathy in your skin. But what are the symptoms of small fiber neuropathy throughout the rest of your body and in your autonomic system? Fainting, dysautonomia, dry eyes, dry mouth, dry skin, dizziness, lightheadedness when standing, gastroparesis, delayed stomach emptying, neurogenic bladder, erectile dysfunction, and abnormal sweating. So if you find that you sweat profusely or you don't sweat at all, that could be a sign of small fiber polyneuropathy. So, how do they diagnose it? Well, the very first thing that they should do is just a very simple blood test to see if you're deficient in B12, because that absolutely is the most common symptom. I mean, the most common cause is just a simple B12 abnormality. But they also want to, if that doesn't reveal anything interesting, they would normally take it a step further, and they would be looking at toxicities. They would want to do a 24-hour urine test, especially for people who work in mining or work in industry or work in agriculture, where you might have been exposed to a variety of chemicals and pesticides and things like that, as well as heavy metals. A 24-hour urine test would allow them to see that. They need to screen for Lyme disease and other things like that. I mean, there's a whole diagnostic workup. And they also absolutely want to look at all the medications you've taken to make sure that you're not taking a medication that has been linked to a neuropathy, right? Let's see. But the easiest way to diagnose a small fiber neuropathy is to take a little 3 millimeter skin sample in your lower leg. A tiny, tiny, tiny biopsy. And they send it off to a pathologist. And if it comes back with your small fibers being looking a very distinct way, then we can say now that here is objective proof that there is something unique and different that's happening in your body. We get to take this out of it all in your head. You know, one of the challenges we have with patients trying to get disability is that symptoms are very subjective. And they go, well, where's the objective evidence? Where's the proof? Where's the proof that there's a problem? This is proof. This is proof. A little freaking skin test. It's going to revolutionize everything. So y'all know you're sensitive. I've been sensitive my whole life. How do we treat it? How do we treat it? Well, so the treatment is the treatment is consistent the whole way. It's all about calming your nervous system down. So the very first thing we got to do is we got to stop anything that's damaging your nerves. So if you're low in B12, we got to get the B12 levels up. If you're low in copper, we got to get the copper levels up. Or if you're taking too much vitamin B6, which most IC patients don't do because B6 is irritating to the bladder. But if you're one of those people where you go, no problem, I'm just going to double or triple my vitamin, that's a problem because B6 is neurotoxic. So they want to make sure that you're not doing something yourself through no fault of your own that could actually be triggering some of this. It's just so interesting when I think about the people in my family who my sister's kind of going through this right now with B12. And it's just so fascinating. Okay. So we got to figure that we want to try to understand the root cause and what could be triggering the root cause. Once we know that, how are we going to treat it? How are we going to calm the nerves down? The first thing we can do is use a low dose antidepressant like amitriptyline. Hello, it's been recommended for IC for 25 years. Of depression because it calms nerves down in low doses. So normally when an IC patient is prescribed an antibiotic, an antidepressant, they give you an extremely low dose. They don't give you the dose for depression, which might be 75 milligrams of Elavil, they might give you a low dose of like 5 milligrams or 10 milligrams, which would be designed to calm the nerves down over time. Of course, the challenge with some antidepressants is they are anticholinergics, and they're fairly hard medications to tolerate. They can give you pain. We call it the Elavil 20 because it makes you just crave sweets. And unfortunately, there's some antidepressants that are linked to cognitive decline and dementia. So you really have to have a good discussion with your doctor about the pros and cons, and come on over to our website. Somebody's asking our website. It's right there, hun. icnetwork.org. Or it's ic-network.com. icnetwork.org is the quickest way to get there. The second thing you can do to calm nerves down is do an anti-epileptic medication like Neurontin. And quite a few patients do use Neurontin, and that is viable. The third thing you can do is, especially if the pain is intense, is use an opiate medication. And I will confess that once or twice a year, my skin is just crawling when I'm trying to go to sleep, and I simply cannot get to sleep. And that's when I will do a quarter of a Norco, something like that, to kind of break through that pain. You can use a topical medication like lidocaine. It's much more effective for skin-based issues. So you can get, which is lidocaine over the counter, or you can ask your doctor to give you a lidocaine compounded cream. And sometimes they create a custom compounded cream that we call it an Amibac cream. Ami for amitriptyline. It might have amitriptyline in it, might have lidocaine in it, might have baclofen in it, might have a few other things in it that will just kind of calm the nerves in your skin down there. This is where neuromodulation has a place, especially for patients with really severe symptoms, which obviously I don't have. And that's really rare in our patient community. And then there is some immunomodulatory agents for patients who have an immune system dysfunction. Okay. So, I don't like not knowing why something is happening. I don't like it when somebody tells me you're sensitive, but we don't know why. I don't like it if I'm in pain and nobody's looked at the area that's hurting. It's like, for God's sake, look at it. Doctor, please look at it. And let's make sure there's nothing funky going on there. Susan says, this is my first time joining. I'm on gabapentin. What do you think about that? I think that if you've got nerve sensitivity, that's an excellent therapeutic choice. If you got super sensitive skin, if you got the signs of central sensitization, Neurontin is absolutely, also known as gabapentin, is going to help calm that nervous system down. And so potentially would palmitoethanolamide, PEA, which is the over-the-counter uh, uh, supplement that has been used for years for pain. We've got many, many, many research studies now that show that PEA is remarkably successful at reducing chronic pain, especially neuropathic pain, including intense acute neuropathic pain. I just came up with a case series where they were giving it to patients with severe pain, and they were having really, really good results. I'll be writing an article on that. I just didn't have time to do that yesterday because I was doing this one. So something like PEA, Peora, might be very interesting in that context. I know it's weird, and I know on the surface it might even be a little bit scary. There's nothing to be scared about. It just explains the sensitivity. And it opens doors as to why this could have happened to you. Why this could have happened to you, and why this could have happened to me. And now we know why patients who go through chemotherapy struggle with chemocystitis, because the chemo damages nerves. It creates a neuropathy in the bladder wall. Now we know why people that are exposed to lead and mercury end up with neuropathies, because the heavy metals damage the nerves. Now we know why some antibiotics can trigger neuropathies because they also are neurotoxic. And I think this is yet one more bullet point that supports you being much more careful with your antibiotics. So that and much more careful with the chemicals in your home, organophosphates, um, pesticides and insecticides and weed killers are now strongly linked to nerve damage like this to some degree. So remember, Roundup is banned in a lot of countries for reasons like this. It's still available in the U.S. because in the U.S. profit is more important than public health and safety. The most important take-home point about this, aside from cleaning up your house, getting rid of the chemicals, et cetera, getting your B12 levels checked, because that's probably what's going on for the great majority of patients out there who have this, is that we can now prove it. We can now prove it with a skin test. And if you have somebody who says, Jill, this is all in your head, you're just making it up that you're so sensitive. It's like, dude, redhead, seriously, have you never worked with a redhead before? We know redheads have more nerves anyway. It's like, let's prove it. Let's do a biopsy. I'll pay for it. If it comes back small fiber polyneuropathy, you owe me an apology, big time. Pamela said, brain surgery, wish you said we need to talk about the pain after I had my right temple. Ooh, yikes. Amy Jo says, what about costochondritis? Well, and April says, what about Epstein-Barr? So yes, Epstein-Barr would correlate with this because viral infections live on nerves. And once you have a virus like herpes, you will always have that virus. It gets quiet, but it becomes active, and then it gets quiet and becomes active. That's why we have canker sores and they heal, and then canker sores come back and heal. That's why we're more prone to shingles after you've had chickenpox, because the chickenpox comes from a virus that is stuck in our bodies. We all have it right now if we've had chickenpox like I did. And so Epstein-Barr, absolutely. That's specifically mentioned in the research that a viral infection like Epstein-Barr could be related to this. Costochondritis, Amy. Costochondritis is an inflammation of your sternum. And if you have costochondritis, basically, if you touch where your ribs meet your sternum, it's tender. If it's tender, that would be the classic symptom of costochondritis. I don't believe so. My dad has costochondritis. That's why I'm pretty familiar with that. Shell says, I've been on antibiotics for 3 straight years. The infection keeps coming back. Well, how do you know it's infection? Have you had a next generation urine test that's proved it? Shirley says, oh no, let's see. So anyway, we were finishing up my spring magazine, and I've got this wonderful interview with Dr. Day, Dr. Elise Day, the author or the editor of this book. She and I were emailing back and forth this weekend because she wrote this huge Q&A for me, like literally overnight. I couldn't believe it. Just most generous woman ever, amazing urologist. And we were kind of talking about, she was sending me all these papers on small fiber neuropathy that I was reading, and it was just like the light bulb was going on. But more importantly, it made me very, very sad for the patients 20 years ago who were told this wasn't real. The patients who were told there was no connection between IBS and IC and vulvodynia. The patients who were refused therapy. The patients who were committed to psych facilities. I've worked with patients with IC who were committed to a psych hospital. And 48 hours, they were discharged with profuse apologies from the head of psychiatry saying, you don't have a psychological issue, you've got a freaking bladder problem. but the family practitioner didn't believe that it was real. And so now we have a way of verifying it. Now we have a way, an objective measure, a freaking skin sample that will tell us if you, like me, have small fiber polyneuropathy. And then from a therapeutic standpoint, it also helps us target our therapies better. Because if you've got more sensitive nerves in your bladder, you've got a completely healthy bladder like I do. Your bladder is a baby bladder. There's nothing wrong with it that you are nerve driven, then we certainly wouldn't be wasting time with Elmeron, which is a bladder coating, as much. We would be instead focusing on things which would calm nerves down, like the amitriptyline, like the Neurontin, like the PEA. And it also makes a better case for pain care. Because think about those doctors who say there's nothing wrong with you, there's no reason for you to be in this pain. But now we can have a test that says, look, I have small fiber polyneuropathy. That is the contributor, the driver of skin pain and bladder pain and organ pain and bowel pain, et cetera, et cetera. So you're going to get this for our members. This is going to be the second story in our magazine. Our first story is the Q&A, Meet the IC Expert, Dr. Elise Day. Then we have a book review. Then we have this article on small fiber polyneuropathy. And it's something that you can show to your family and go, look, guys, I didn't make it up. It's real. What is that noise? That was so weird. All right. Arlene says, how long does it usually take for Elavil to start working? I'm on it for the first time, 25 milligrams for depression, but I asked for this specific antidepressant because of IC. Gosh, I don't remember off the top of my head. I know I took it for 3 months myself. Well, let's just look it up. Hold on. Let me just go to my website real quick. I bet. I have all these random factoids in my brain, but sometimes they just don't come out like they should. So I've gone to the IC Network website. I'm at the treatment pull-down window. Oral medications. Amitriptyline is a tricyclic antidepressant. It has a 63% significant improvement at 4 months, making this medication more difficult to tolerate. Drowsiness, cardiac arrhythmias, irregular heart rates, tachycardia, rapid heart rate. And if used daily for a long period of time, 3 years or longer, it has been linked to some cognition issues. So, Arlene, it's, I don't know how old you are. You definitely want to maybe talk to your doctor about, is there another antidepressant that's not an anticholinergic that you could use that is not linked to these cognition issues? I mean, doing it for a year, really probably not an issue according to the research. But what they say is if you take an anticholinergic in quantity every day for 3 years, that increases your risk of cognitive decline or dementia like 50%. So it's really significant. So short term, it's an interesting short term experiment, maybe not a good long term option. Fake Homestead, I just want to let everyone who's chemically sensitive and are afraid of getting the COVID vaccine, that she got the Johnson & Johnson vaccine 24 hours ago, and the only side effect I have is wanting to sleep. I have not had a fever. My arm is not sore. But I am fatigued. I set aside this time to rest and recover. I am thankful. Please do not be afraid. Shell says, it said there was an unidentifiable virus. We're going to rerun the test. But honey, a virus is not E. coli. E. coli is a bacteria. So there are 3 different things that can infect your bladder wall: a bacteria like E. coli, a virus like polyoma BK or Epstein-Barr or COVID, or a fungus like Candida. So there are 3 different types of infections. possible in the bladder. And what's interesting is our own US National Institutes of Health has the best research team working on pelvic pain called the MAP Research Network. That stands for the Multidisciplinary Approach for the Study of Pelvic Pain. Their research is fantastic. We summarize it every year on our website. It has taught us so much. They were the ones who, about 5, 6 years ago, actually discovered that many patients who were flaring not because of a bacterial infection, but because of a fungal infection. Candida. Candida. Candida can be systemic. Candida can be in your bloodstream and it can be in your urinary tract. And I had a urinary infection for 2 freaking years. 2 years. It was a drug-resistant Candida labrata. It was a bitch to kill. And I will tell you, the pain of fungal infections in the bladder is almost worse than pain of a bacterial infection in the bladder. So that's why, Shell, you want to make sure you have a next generation urine test that differentiates between bacteria, fungus, and virus, because they are all treated differently. If you've got a fungal infection, they're going to give you antifungals. And the worst thing you can do with a candida infection is take an antibiotic, because that's just going to continue to kill the bacteria that normally kill the candida. I mean, our body is really on the inside, this glorious community of bacteria and fungus and virus that all control each other. It's an ecosystem. It's an ecosystem. And so there are good bacteria that kill bad bacteria. There are good bacteria that kill fungus. And the virus is a whole nother story. And so when you take an antibiotic, you kill all the bacteria, especially the bacteria that kill candida. That's why patients get candida infections, yeast infections, after doing antibiotics. That's why they have you take a probiotic to restore good bacteria back into your gut and back into your body. And also, too, sometimes when you take an antibiotic, you don't kill everything. It leaves pathogenic bacteria in place, and that's why C. diff happens. So if you've taken an antibiotic and then a period of time afterwards you start having bloody diarrhea, that's because your biome was destroyed or damaged by the antibiotic, and that's now allowed C. diff to prosper, and that then gets treated with another antibiotic, which then does more damage. So mark my words, what we're going to be seeing, probably in the near future rather than the far future, is we're going to be treating pathogenic bacterial infections with beneficial bacteria that kill the pathogenic bacteria, just as we will be treating fungal infections with the correct bacteria that would kill that fungus. That's absolutely in the works. It's fascinating. But the thing is when we keep taking antibiotics, we're just, it's like taking a flamethrower to a tropical forest. You're killing everything. You're killing the good. There's one bacteria that nourishes the cells of the bowel. I think that the cells lining your bowel only eat a certain type of food. And the human body does not make that food. Only bacteria make this food. So when you take an antibiotic and you kill that bacteria, you have now the nourishment for the most important cells lining your gut. And we also think that same thing is probably true in the bladder wall, but we don't quite have proof of that yet. And so we don't want to just keep randomly taking antibiotics and disrupting the biome and creating ecological chaos in our bodies. Pamela said, my doctors and my physical therapists think I'm crazy. I am mentally crazy. Oh, girl, give yourself a break here. You're stressed. You're exhausted. You're tired. This has gone on for a long time. You've had pain and discomfort for a long time, and people don't understand why. And the small fiber polyneuropathy will help perhaps identify why you're struggling. And so this is really good news. It will justify treatment. It will justify pain care. They can no longer say, hey, there's nothing wrong with you. You can say, no, look, here's my biopsy results. I have small fiber polyneuropathy. That causes pain. It will only make your case for getting better pain care. Susan said, got my COVID-19 vaccine, the first of 2 by Pfizer. The only side effect was that it caused my bladder to flare for 5 days. Researched the ingredients, saw potassium chloride, sodium fluoride, and sodium phosphate. I knew immediately what caused the flare. I will get the second dose because I feel it's necessary. I've had IC since 1993. Just wanted to give a heads up. Susan, you and your IC and my IC, at least my bladder pain, started the exact same year, 1993. David says, what's the difference between small fiber neuropathy and small fiber polyneuropathy? Same thing, hun. It's just a different way of saying it. Some says, I have IC. Maybe I still have because my bladder is still full. I don't quite understand what you're writing here. You healed it now and you're 2 years majority symptom free. Good. Good, good, good. She said she's drinking DMS. No. We don't drink DMSO, hun. You might be doing MSM, but certainly you would not be drinking DMSO. Wow, that would be very dangerous. Anissa says, does IC cause PGAD, persistent genital arousal disorder? Well, we have to break it into our subtypes. We've got 5 fundamental subtypes for IC. Subtype 1, Hunner's lesions, not cause PGAD. Subtype 2, bladder wall driven, does not cause PGAD. Subtype 3, pelvic floor driven, can be associated with PGAD. Subtype 4, pudendal neuralgia, absolutely will cause PGAD. IC subtype 5, chronic overlapping pain conditions, small fiber polyneuropathy, not going to cause PGAD. So if you've got persistent genital arousal disorder where you're feeling this sense of arousal, but it's painful and creepy and disgusting, and you don't want to tell anybody about it because it's so embarrassing, then you need to tell your doctor about that because that means your pudendal nerve is irritated, and usually irritated because of very tight muscles. So the therapy for that is going to be to send you off to pelvic floor physical therapy muscles, as well as to give you medication to calm the nerves down, like a low-dose antidepressant or an anti-epileptic. April, or maybe even PEA. April Tobin, what about streptococcus? That is a bacteria. Shell says, I always have E. coli as well. So E. coli is a bacteria. So when you do a next generation urine test, you have to, E. coli, you can't just say E. coli anymore. We have to know the type of E. coli. Just like in the United States, we've got people from every state and we've got all sorts of heritages. E. coli have lots of different heritages. And it's important to track it. We want the full name of it. And that's what the next generation testing will do. Not only will it identify it, but it compares the DNA it finds with these big national and international databases that follow and track drug resistancy. So it will also tell you what the most effective antibiotic will be to kill that specific E. coli. Now, I had a discussion with somebody this weekend, somebody in my family actually, who um, uh, let's see, how do I want to say this? Her bladder has been an issue for decades. And she has absolutely had some infections. Okay, no doubt about it, because she was sexually active, et cetera, et cetera. And when you have sex, that pushes bacteria into the bladder that could potentially cause infections. Her last infection was 2 years ago. But since that time, she has been aggressively pushing her bacterial prevention strategy, which is going to be drinking water, drinking cranberry juice, taking D-mannose, etc. And one of the things that I said to her is I said, listen, you're forgetting that the bladder only knows one language: frequency, urgency, pressure, pain. You haven't had an infection in 2 years. So, what do you feel every day? She says, well, I always feel like I'm right on the edge of an infection. It's like I feel like it's like it's almost there. Almost every day I feel that. And um again, I brought up sensitivity, that you have sensitive nerves too. We know that because you have a sensitive sense of smell, a great, beautiful sense of smell, and you have sensitive skin. So we know that your nerves are more sensitive. So could it be that the symptoms you're having every day are not the precursor to infection, that it's actually a manifestation of this this sensitivity that we have in our family? And could the cranberry every day actually be triggering that sensitivity that's giving you that feeling like you're going to have infection every day? Because that cranberry would be irritating, especially if you're older. If you're watching or listening, I love you. I got your back every single time. You know, PTSD is real. If you have had bladder trauma, if you have had pelvic trauma, if you had, like for me, that 2-year Candida glabrata infection, which was just insane, so painful, I can understand why you would be thinking you would not ever want to go there again, because I don't ever want to go there again. I mean, like, remember when I had my hysterectomy, I told the doctor, I don't care about the cancer. Like, please God, don't hurt my bladder and send me back 20 years. I'm doing great right now. That's PTSD speaking. And sometimes you kind of have to balance that with practical hands-on knowledge. And the fact of the matter is that the bladder only knows one language: frequency, urgency, pressure, pain. You could have a bullet wound and it would feel like IC. You could have a stab wound, it would feel like IC. You could have a fungal infection, it would feel like IC. You could have cancer, it would feel like IC. Or it would feel like infection because they feel exactly the same way. IC feels like the world's worst infection that never goes away, right? That's what IC feels like. And so, again, when we think about causes of action, does everybody have infection? No, absolutely not. We have clear subtypes now. We have subtypes now. Some of you have Hunner's lesions, viral infections. Some of you have chemocystitis. Yes, many of you, if not most of you, have a muscle injury, a tailbone injury that's created muscle problems down in your pelvis or nerve problems down in your pelvis. And for those of us who've got the related conditions, because we may have small fiber polyneuropathy. It's good to know. There's confidence in knowing. It's comfort. It's like, oh, okay, that makes sense now. Now I know why my skin is so sensitive. Now I know why my bladder is so sensitive. Now I know why my lips are so sensitive. Okay, I get it. It's no longer been made up. It's real. And there's comfort in that. And then there's comfort now in looking at the research and knowing how to treatment and not wasting your time doing therapies that would do nothing to calm nerves down. Sherry says, I have COVID and your IC really acted up. What should I do? So, Sherry, we have a survey on our website. I hope you'll take it about IC and COVID because we really want to hear from patients like you who are going through it. I think you got to be on your best behavior when it comes to your bladder. So be following the IC diet. I would be drinking plenty of water to dilute your urine. Don't eat or drink things that could be really irritating to your bladder, and that's hard because they often want you to take high levels of vitamin C when you have COVID. So if they're telling you to do that, make sure that you get calcium ascorbate rather than ascorbic acid. There are two different forms of vitamin C. Typical vitamin C is ascorbic acid that's derived from fruits. But calcium ascorbate is a low acid vitamin C, and you might be able to get away with that. Um, Ester C is an example of a low acid vitamin C. You got to eat healthy. Try to eat the best foods you can do. Give your body time to rest and recover. Be patient. Don't stress about it. Healing happens. That's the one thing that we know is your human body's wired to heal. You got to let your body try to heal through it and fight it. And also talk to your doctors about some of the what do they call it? The antibody starts with an A. You know, where people have had COVID and are over it, donate their blood, and that becomes potential therapy for other people who have COVID because it gives you the things that your body needs to fight it. Come on, the word is right there. Shannon says, how can I get tested for candida in the bladder with a next generation urine test? You just go to bladderhealth.org and you can order it right there. So Shell says she was negative for candida, but she was positive for ureaplasma. So ureaplasma is actually a more difficult to diagnose bladder infection. It is a pathogenic infection. And so again, Shell, next generation urine testing would be good because that would tell us what the right antibiotic would be to treat that with. Hello, Erin. How are you, hon? Nice to see you. Shannon says, how can I make more good bacteria in my body? Well, you can't make it. You have to eat it. And that means you're going to be doing probiotics, doing kefir, doing yogurt. A lot of people think yogurt's bad for IC, and obviously we don't want you to do chocolate yogurt or lemon yogurt. But here's mine right here. This is peach coconut milk yogurt with live cultures. So normally what you do is you repopulate your body with good bacteria. There is a very good food documentary, fascinating story. They were trying to find out what the perfect food for the human body is. And they went all the way back to studying mother's milk because you would think that mother's milk is the perfect food for humans. But when you study mother's milk, it actually doesn't contain much food at all that the human body uses. What it contains is food for good bacteria. So mother's milk is actually like colostrum. It not only gives your body good beneficial bacteria, it feeds the beneficial bacteria in the gut. Shell says, yeah, fermented foods and probiotics. See, I have a little trouble with fermented foods like sauerkraut because I get gas so easily. But the yogurt is piece of cake. April says, I was diagnosed with IC in 1992. It always hurts before and during your period. So you might be one of those patients where you're being hormonally driven. There's a group of you who are. Pamela says, who does the neuropathy test? And that could be a skin doctor or a neurologist. Sharon says she had the Pfizer vaccine with Hunter's lesion. She had no flares or side effects. Cindy had the Pfizer, no side effects, no issues. Helen says we're cutting out frequently today. Damn it, really? Really? Okay, you guys on Facebook, would you please, can you start putting when the screen is freezing or not? Let me go make sure, this is a cable. It's supposed to be high speed and sometimes it works, but God forbid somebody turn the TV on. Hold on. Let me make sure the TV didn't get turned on. Good morning, Mom. Good morning. Okay, I'm doing my meeting. Thank you. All right. The TV is not on, so maybe it's not from my end. Anybody else on Facebook, would you please give feedback as I go right back to because I'm paying a hell of a lot of money for this connection, almost $200 a month to do these live feeds. So Cindy said, I've been prescribed methenamine to prevent recurring UTIs. What do you know about this drug? But I don't want to take more antibiotics, but heavy antibiotics on and off for 4 years. I was still convinced to try it. It's a viable option, hun. It adjusts pH, et cetera, et cetera. You know, you have to understand that if you've had a hysterectomy, you're on birth control, or you're perimenopausal or postmenopausal, the reason why you're more prone to infection is because of your skin. Your bladder is like your mouth. It's a hollow organ covered with a really thick coating of mucus, and the purpose of that mucus is to protect this tissue. So your vulva's wet, your vagina's wet, so is your urethra, and so is your bladder. We call it the mighty mucus. Oh, Carol says antigen therapy. You know, I was thinking that, but no, it's something else. Like, it'll come to me. It'll come to me. All right. So anyway, getting back to estrogen atrophy. So that nice thick coating of mucus in your bladder, it acts as a barrier. It prevents bacteria from reaching the cells to infect the cells. Unfortunately, it's estrogen dependent. So when you're young and you have lots of estrogen, you have lots of mucus, and your body is pretty good at preventing infection. When you're older, you have much less estrogen, much less mucus. Your skin is drier, and it's much easier for those bacteria to reach the cells of your bladder to infect your bladder. And so Cindy's saying, I'm 69 years old. I went into menopause 20 years ago after chemo for breast cancer, and was told because of my estrogen receptors, I shouldn't take estrogen. Finally started taking vaginal estrogen 3 months ago as the dryness has resulted in a prolapse. Now I'm considering surgery. Yeah, so if you look at, Cindy, I would encourage you to Google topical estrogen safety, because topical estrogen therapy is considered remarkably safe overall with the research. And so that might give you some comfort in using that, or give you some good dialogue points to talk with your doctor about it. The other challenge with menopause and postmenopause is estrogen also helps your muscles stay strong. So what happens is, with less estrogen, your muscles tend to get a bit weaker. And when they get weaker, then we start dribbling a little bit, right? Things start to get a little bit more kind of loosey-goosey. If you jump or you startled and you leak, that can be associated with just aging and the loss of estrogen for those muscles. And that's when we want to be doing some Kegel exercises and things like that if you're dealing with incontinence. A prolapse is a more severe weakening of the muscles, where the pelvic floor muscles are not supporting the organs in the proper position, and they're starting to fall now. And there comes a point with a prolapse where they will either give you a pessary, which you insert in your vagina and it kind of holds things in place, or they may consider doing a surgery to kind of tack things up. And I have a good model that I can bring out and I can show you if you want. Cindy, the other thing you want to think about for the prevention of UTIs is an over-the-counter product called Allura, Ellura, or Prevent. Where is it? It's right here. Both Allura and Prevent are proanthocyanidin products, also known as PAC. That is the active ingredient in cranberry that can help prevent bacteria from attaching to the bladder wall. It's on the bacteria demannose to a certain degree, so the bacteria attach to the PAC molecules, and then you pee it out, and the demannose molecules. So Prevent is like Allura. It's a PAC demannose combination. So look up that. Allura can be quite expensive, over $100 for a month's supply, where this is about half the price. Okay. Jackie says, what specialized test would you recommend? So many providers use a standard test. I have IC, IBS, colitis, recurrent strep, and a diagnosis of C. diff. I also have constant yeast, but my bladder is not checked for candida. I self-cath 2 times a day with sodium bicarbonate, lidocaine, heparin, and receive pelvic floor therapy. I try my best to adhere to the diet restrictions and only drink water. Thank you for sharing this important information. Your advocacy is greatly appreciated. You know, Jackie, honestly, the next generation urine test is, in my opinion, critical for you because you do have a history of C. diff and you may have a history of candida. And at the AUA meeting, the American Urology Association annual meeting last fall, the top IC researcher in Canada gave a great lecture on why next generation urine testing will be replacing urine cultures sooner rather than later because the data is so much more specific. You got much better data with the next generation tests than you do with the urine culture. Urine cultures can miss up to 95% of the potential bacteria and other things living in your urinary tract. So I think it begins with hard data. You know, what's in there, what's growing in there. Because at this point in time, you're guessing. You have a very complex history here. If you have a history of C. diff, you've got a complex history. And so that next generation test is really viable. The other thing that it's really important for you to know is that, I mean, I applaud you that you're doing your home rescue installations. Never, ever, ever, ever change the formula on your own. You always have to use the formula the doctor gives you. You have to be really careful with the sodium bicarbonate because the sodium bicarbonate is what causes the medication to pass through the bladder wall and get deeper in your bladder wall. And it could potentially reach blood vessels. And so you never, ever, 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 ever increase sodium bicarbonate. Okay. Be super careful with that. And you're doing the pelvic floor physical therapy. Well, Jackie, you know, I'd love to talk to you this week. It would be really interesting to try to subtype you. Let's see if we can figure out what fundamental subtype you could have. The fact that you've got the IC and the IBS, I would want to know, do you have super sensitive skin? Do you have a wicked sense of smell? If you do, that puts us over into IC subtype 5, central sensitization, chronic overlapping pain conditions, small fiber polyneuropathy. Yeah, why don't you give me a phone call this week? You know, you guys, you can go on over to our website or go to our Facebook page. I think it's even on our YouTube page, YouTube channel. We do have a 1-800 number, 1-800-928-7496. Believe it or not, I really do answer the phone. I mean, we have staff, but I answer the phone too. They get routed right through my desk if other people are busy. So I talk with patients every day. And I'd be more than happy to try to sit down and talk with you and go through some of your history a little bit to see if we can give you some better questions to ask your doctor. I'm not a doctor. I don't give you clinical advice. My job is to open doors, kick you in the butt, get you back into the doctor's office and to start asking a few different questions, right? Information is power, my friends. Information is power. What are you drinking today? You know what I'm drinking? Organic peppermint herbal tea. April says she does lopospherical vitamin C. You put it in water, it doesn't hurt the stomach, goes straight to the liver. But it could end up in the bladder, hun. I don't know. I'm not familiar with that. Susan loves ester C. Erin says she loves coconut yogurt. Yeah, I do too. I do it almost at least 5 days a week. Debbie says Facebook has frozen 3 times. You know, I'm going to have to look at the, hey, you know what? The next time it freezes, can you please write the time down? Write the time down in Facebook so I can go back to the recording and look at it and see it on the recording so I can give it to the cable company. I mean, there's so many factors. It's the cable from it's a cable from my house to the nearest station, and then it's from that down to the center of town, and it's from that to the statewide. There are all sorts of ways that the internet can be slow and freeze. April says it's freezing for her. Courtney said not freezing for me. Sharon says, I've watched your videos for so many years. Man, you know what, Sharon? Oh my God. It's my project for this year is I want to do a ton more videos. I just don't have the freaking time right now. It's crazy. I should be filming at least one video a week, but man, life is busy, right? It's hard right now. Susan says she's not having any problems. Shelly says it's frozen 5 times. Aaron says, what's the best direction for nerve issues? That's going to be a neurologist. Aaron says we're frozen. Debbie says we're frozen. Crap. Lynn said just froze again. Helen just froze. Facebook lagging. Freezing, freezing, freezing. No, 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 no. Lorraine says, am I hearing that Pfizer vaccine is the best to get? No, I don't think anybody's made that connection here. Lorraine says, Jill does answer the phone. I've called her a few times and she really does answer and listen to you and help you. Love you. Oh, thank you, hon. Right back at you. This is my new thing for love. This is our symbol for love in our heart. Oh, Andrea, thank you for sending me 50 stars. Guys, if you find these helpful and you're on Facebook, you can give me stars. That's very nice. Or you can come on over to our website and you can sign up to become a member and get our magazine, the IC Optimist magazine, or, just to support all this happening, right? Because it doesn't happen for free. I paid for everything for 5 years myself. First 5 years. Oh, hold on. I smell something burning. Hold on. Whoa, something's burning. What's burning? Okay, we have new smoke detectors, so. Okay, don't use it again. Okay, don't use this again until I look at it. All right. My mother does not handle toasters correctly. You would be stunned at the number of things she's burned in the toaster. As she just did again. And I just put up new smoke alarms. No, I don't need all those to go off. Andrea, thank you so much. Debbie, thank you for 99 stars. I really appreciate that. Aaron says, scared to get the vaccination because I'm terrified I'll flare. Aaron, again, girl, listen, you got to weigh the pros and cons here. Getting an active COVID infection could be devastating. I mean, you could be in a severe flare for months. You compare that with a week-long flare from a vaccination. I mean, seriously. And if you go and you watch all this here, you watch the feed here on Facebook, quite a few patients are saying they had it and they were fine. One patient said she had a week-long flare. I think 2 patients said they had flares, but at least 10 or 12 patients said that they had the vaccine and they had no problems at all. Debbie is getting the Johnson & Johnson vaccine tomorrow. Ashley said, I just got diagnosed with IC and pelvic floor dysfunction. I've been following the IC diet for 2 weeks now. No improvement so far. All right. So Ashley, this is for you. This is for you. Since you're a newly diagnosed patient, we need to talk about their subtypes. Not everybody's the same. For some people, IC begins in childhood. For others, IC begins after menopause. For some people, IC begins after having a baby. For others, IC begins after falling on their tailbone. And when you look in the bladder, you see this rich diversity in this patient population because a lot of people, myself included, have a completely normal bladder, nothing visibly wrong with their bladder, while others have bloody wounds in their bladder that bleed all the time. They've all been given the diagnosis of IC, but are they the same? Absolutely not. They are not the same. And so we now are doing at the top levels in the ICU world something called subtyping. The odds of your local doctor doing this are zero. It's really at the upper echelon that the top IC doctors are doing more subtyping, where they're trying to give you a more specific diagnosis. You are an anatomical mystery to be solved. We have to try to understand what in your pelvis is triggering your symptoms. Yes, it could be your bladder, but it could also be your pelvic floor muscles, and it could also be some inherited sensitivity. It could be pretty much everything. So over on our website, icnetwork.org, I have a video called the 5 subtypes of IC, and I have a section under our IC main educational category that talks about subtyping. That's the first step is before we can talk about the right therapies for you, we've got to try to understand your anatomy. If your symptoms began after a trauma, after a fall, if you're a football player, if you're a bike rider, victim of sexual abuse, we're always going to look at muscles. If your symptoms get worse when you sit down, but they improve when you stand up, we're going to be looking at muscles and nerves. If you can't urinate right away, if you hesitate to urinate 5, 10, 15, 20 seconds, that's a sign that your muscles are tight. So it's not, we don't think of this as a bladder disease anymore. It's a pelvic pain syndrome because we know that structures outside of the bladder are often involved. All right, Aaron and Lynn said it froze at 2:10 Eastern time. All righty, good. Thank you. Keep coming up with those times. So, guys, it is now 2 o'clock. After 2 o'clock, it is time to start our Zoom portion of the meeting. So it's interesting. East Coast is having freezing. Anybody on the West Coast notice freezing on Facebook? Anybody on the West Coast, California, Oregon, anybody? Let me just go make sure. Hold on. I'll be right back. Can you not turn on the TV? Don't turn on the TV until I'm done, okay? Because it's all freezing and stuff. Okay, so did anybody in California freeze? Anybody on the West Coast have a freezing moment on Facebook or YouTube? Looks like it's East Coast. Yeah, Southern California had freezing too. Crap. All right, guess who I get to call tomorrow? Damn it. Dang it, dang it, dang it, dang it. All right. Well, this is what we're going to do. It is time to start the Zoom portion of the meeting. The way you can get there is if you go to the website, icnetwork.org, go to support, the pull down menu. The second link is live support group meetings. And in there, you will see a link to Facebook, a link to YouTube, what you guys are watching on right now, and a link to our Zoom meeting. And that is actually how I'm starting it right now. Unmute your speaker or increase your volume. I'm connected to computer audio. Well, all right. So I now have and what on earth is wrong with my hair? I am Miss Fuzzy right now. So let me get my invites for you. And if y'all want to come into Zoom, I would be more than happy to talk with you. If not, that's fine. We would just stay. Facebook and YouTube are going to stay open. So Facebook and YouTube, you're going to hear it. All right, Facebook, you have your invitation there. Okay, YouTube is not freezing. YouTube, there you go. There is your invitation. So with the Zoom portion of the meeting, you get to come in and talk to me and show your beautiful face and tell your story, and you're going to get coaching from me. This is what I do with patients on the phone. And again, remember, I'm not a doctor. I don't give you medical advice. My job is to just help you try to understand your anatomy a little bit more, and also give you more questions to ask. So it's about opening new doors. That's my job, is to open new doors. So if you want to do it, come on in. I'll let you in one at a time. I will be right back. You guys, it's time to take a bio break. If you need to pee, go ahead. Come on in and go on. No, you know what I mean. Go take a bio break. I'll be right back. Hi, Shirley. All righty then. Hey, okay. So guys, again, if y'all want to talk to me personally, you can come on into the Zoom meeting. And if you don't want to do it, that's fine. Facebook, there's your link again. Otherwise, it might just be Shirley and I, which is fine. I'm good with whatever y'all want to do. All right, Shirley. Hello, my friend. How are you doing today? Okay, I can't hear you. You're not muted. Is that my end? Oh, well, that's because my volume is down. Okay, let's try this again. There you are.
Okay.
How are you? How is life today?
Oh, my personal life is not good, but I'm just wondering what category subtype I fit into, because when I was born, my epithelial layer within my bladder, most of it was never formed from birth. And yes, I know. When I first had, they did a sonogram, and not at the doctor's office, but they did the sonogram, and they had everybody in the sonogram over to look and see what was on the screen, and they wouldn't let me see it. And they told me, "Oh, your doctor will tell you." It took 3 weeks to get the results. But yeah, I got one leg shorter than the other.
Okay.
I had Hunter's lesions.
Okay.
Yeah.
Well, so when you did you?
It was horrible when I was a kid.
Okay,
Yeah.
you had a lot of bladder problems.
Yeah, I had
What were they?
Peeing on the playground and in the classroom. I couldn't control,
So you were incontinent as a kid. Did you have pain as a kid?
Oh yeah.
Hmm.
And nobody listened to me. You're a dumb kid. I'm glad that's kind of changed now.
Yeah, yeah. And has that been steady and consistent your entire life? I mean, have you ever had periods where your bladder symptoms have gotten better?
Oh yeah.
Okay.
But sometimes I wonder, since I was born like that way, if I'm just used to it and that's my life and I just accept it.
Well, remember that puberty would have potentially helped you tremendously, because during puberty your estrogen turns on, and it's the estrogen that helps your body produce mucus. So when did they when did they do that test where they had everybody come in and look?
Oh, the sonogram, right before I went to the urologist that diagnosed me with IC.
Okay.
You had to run and get the smelling salts because I almost passed out.
Uh-oh.
Yeah, it was awful because my dad had it. So
Are you dizzy right now? Okay, well, guys, she's walking and standing. Are you okay?
I didn't hear you. My phone was running out of juice. So I
Okay.
had to plug it in.
Are you okay right now?
Yeah, I'm okay. I had the DMSO treatment, 6-week DMSO treatment.
Okay, but you just said, did you almost just pass out right now? Just a second ago?
No, I almost passed out. I almost passed out when I got to the urology office.
Okay.
And the diagnosis was IC. I was like, oh wait.
Okay. Okay.
Yeah.
A sonogram does not necessarily visualize the health of the bladder wall. So what
I
were
don't know
the
how, well, they were able to see that, and when I went to the urologist like 3 weeks later, this is like 20 years ago.
uh-huh.
Yeah, and that's when he told me about my bladder wall being incomplete. He said you must have been born that way, and I've only
Okay.
met like 1 or 2 other people that have had it like that, like I did.
What how much of your bladder is missing your bladder lining?
Oh God, you know what? I used to know, and I don't remember. It was so long ago.
Okay.
I don't.
Okay,
I just
so
don't have a lot of problems, other than I just got done having a UTI, and I hardly ever get those.
and how old are you now?
I'll be 59 on Thursday.
Okay. Okay. And so we're also now dealing with the effects of estrogen atrophy. So for the
Yes.
bladder wall that is now going to be drier. So I mean that would just a birth defect is very different from the typical thing that we see patients. I don't know uh I don't know the type of birth defect that they would call that. It'd be very interesting to figure that out. Um,
Yeah.
um, so,
My IC was my diet affects my IC.
well, I mean,
So.
your bladder wall is compromised, obviously.
Oh yeah.
So
Totally.
you're absolutely going to be subtype 1, subtype 2 for sure.
Subtype 2. Okay.
Okay, but do you have active Hunner's lesions?
No. No, I
Okay.
haven't had those in years. I
Okay,
used to
so
get them cauterized. I guess they don't do that anymore.
no, they do. They still cauterize
Oh,
it.
okay.
So when was the last time somebody looked in your bladder?
Um, it's been a couple of years, and
Okay.
after this UTI, I'm thinking I got to make an appointment and go in and have somebody look in there and see what's going on.
Mhm. Are you using any topical estrogen?
Yeah,
Okay. Does that help?
yeah. Um, well, I was one of those. Whenever I had my period, it would give me a UTI. So I had a urologist that used to suck it out every month. I would just show up at the office, and he would suck it out, or else I'd get a UTI. It seemed to work for me. I guess they're not doing that anymore.
No, not so much. You have
Yeah.
you have bacteria that live in your vagina, bacteria that live in your urethra, you've got bacteria that live on the skin, and you have bacteria that are supposed to be in the bladder. The bladder is not a sterile organ. There's good bacteria in there. No, I have no clue what that was all about. The question now is, where are we today? I think that IC subtype 2 bladder wall driven has clearly been your lifelong issue because that's what they told you. So you've had
Yeah.
a sensitive, vulnerable bladder wall that means that you've got to protect it from chemicals and other irritants and follow the diet and do everything you can not to expose it to harsh acids and other irritants, right? And I would assume that because your bladder has been more painful for a long period of time, that you probably do also have tight muscles. I call
I
it
do.
I call it the
Yeah.
chicken versus the egg dilemma, which comes first, the chicken or the egg? And for us,
I
it's which
know.
comes first, the bladder or the pelvic floor.
I,
So
I did the internal where they
yeah,
go internally and they try to
yeah,
make your pelvic muscles not as tight.
yeah.
But I felt so weird. I didn't go. I just didn't complete that. So
Girl,
I'm kind of thinking I should go back.
don't you think? Don't you think?
Yeah.
We're going to be doing therapy that involves somebody's fingers up your muscles or up
Right.
your
Yeah.
rectum.
Mhm.
But that truly is the only way to reach those muscles. And it's remarkably successful. And so you just gotta just like, I think the more you learn about the anatomy down there, the more interest it kind of takes you away from the embarrassment into the, okay, what are you touching? Right. Okay. What is that? What are you
Yes.
touching? Is that my piriformis muscle? Is that my levator muscle? And when
Yeah.
you know, can focus, and then because remember, physical therapy is really a two-way street. They're always looking at your face to see how you're reacting.
Yeah.
You need to be able to tell them what you're feeling as they're working with stuff, so that they can make sure that they're working in the right area. So you're not a typical patient at all, not even close. You have got,
No,
but the good news is we got the right therapies. And so, clearly what would make sense, according to the American Urology Association, is it would be very smart to try some of the supplements. They recommend the supplements before Elmeron and other therapies.
I know. I love the Elmeron, but I didn't take the full dosage that they wanted me to take. I only took like one a day.
But did you ever try Sister Protec or Bladder Builder?
No, I haven't tried
Well,
anything else.
so that's the next step. I mean, and the AUA says that should have been your first step before you did the Elmeron. You should have tried the supplements first, because they carry much fewer side effects.
Right.
And
right, yeah.
so you could try, these are the supplements. Actually took them off my shelf this time.
Just a tip.
Bladder Builder is the top supplement right
okay,
now, because it has the pain fighting PEA in it also.
Yeah.
If you're super sensitive, we've got the Bladder Rest.
Yeah.
Cystro Protec is on an extended manufacturer's delay, so there's no point in talking about it right now because we don't have it, and we won't have it for probably another month. What we do have is Cysto Mend, which is a very close match to Cystro Protec. So I would be looking at those three. And then the last one, Cysto Renew, is also on a manufacturer's delay. So,
Wow.
Yeah, it's COVID. COVID has put.
Well, yeah,
It takes.
It gets blamed for everything.
It takes 12 weeks now to get a new production run for supplements because of all the delays at the factories.
Oh my gosh,
Yeah.
That's so ridiculous.
So, I would just want to know what the health of your bladder wall is. I would want to know the viability of the estrogen therapy that you're doing, and is that showing provable changes and improvements in your skin down there? I would want to know what's going on with your muscles. And remember, as long as your muscles are tight, it's restricting blood flow to your bladder and other structures in your body and down there.
Also, I had surgery on my back, my lower back, and my neck.
Yeah.
So I've had like 4 surgeries on my spine, which I know doesn't help.
Right. Right. So carry hope in your heart, my friend. Listen, I mean, your situation is very unique. And the good news is, the sad news is that you as a child had to go through that, and I'm so sorry that affected your life to the degree that it did.
And I couldn't get nobody to listen to me. They just thought I was lazy and didn't want to go to the
Well,
bathroom. It was something fluke that just happened.
Yeah, that's the way it was back then. I mean, I attended an IC conference where one of the top IC researchers said, supposedly the children's specialist in IC said children didn't feel bladder pain, which was,
really?
Yeah.
Interesting.
And I stood up right away and went, "You're wrong."
Yeah.
And luckily another doctor stood up right behind me and said, "Jill's right. You're wrong. Children absolutely do feel pain." We're getting better with that now. We need more pediatric urologists who will specialize in this. It's a hard sell to get doctors to do it. But you have an abundance of things now you haven't tried. You haven't done the pelvic floor work, and we've got the supplements potentially that you could try as well. All right. So talk to your doctor, see what they think.
Right. I definitely will. I was very paranoid when I had my daughter and my kids, because I was so afraid they were going to get IC, but I think both of them have skated.
I think you would know. You would know. Birth defects. Birth defects often are the result of some sort of chemical exposure to the fetus through the mother, and so at some point in time, something happened that disrupted growing in your urinary tract. But obviously, your children did not go through that same chemical exposure. So, a big giant hug to you, hon. Here's the new hug right here.
Thank you.
Okay, nice talking with you.
Okay, nice talking to you.
Okay, let's go to Shell. Hello, Shell. How are you today?
Hi, Jill. I'm doing okay. Thank you for everything that you do and for your advocacy for us, because we need more people like you, and so that our providers can understand
Yeah,
more.
it's hard. We have to prepare for the time that I won't be here to do stuff. I mean, I want to be here for another 10 or 15 years. But that said, we got to start training that next generation of IC activists. So if anybody out there is interested, I would be more than happy to help you, get started doing this. Well, how are you feeling today?
I'm feeling okay. I'm a little frustrated because I was so excited about the InterStem, and I'm only, I think it'll be 2 weeks on Tuesday since I got it done. So it's still, obviously very new.
Mm-hmm.
And I was like, all this week I've had so much like pulsating pain in my sacrum
That's not good.
and like this pressure feeling in my spine. And it's just like, it's still helping like the urgency. But it's like, I'm just praying that it's not permanent.
Well, have you talked to your doctor about it? And
I'm gonna call them tomorrow. I was hoping that it was just gonna magically go away and get better.
so, I think that the first logical question, but you need to get it from them rather than from me, is should we turn it off for a couple of days and see if the symptoms go away?
Yeah, and I have been like turning it down because they said, if it's okay to turn it down or off, just to
Okay.
let them know. And I've been kind of turning it down to see if maybe that will help.
And what happens when you turn it down?
So it doesn't, I still have the pulsating pain, but the pressure in the spine and like the headache gets better.
Okay.
And then all of a sudden it just picks up and gets back to the same spot again.
Well, girl.
And so like I turn it down again, and it's that same process. So I have arthritis in my sacrum, and they said it's about half the size as it's supposed to be. So I'm wondering if maybe it's just so irritated from the procedure.
Yeah, but I'm a little bit worried about your headaches, hon.
Yeah.
That means that, your spinal cord potentially is being affected. I mean,
I know.
Normally, did they put it on a sacral nerve or a pudendal nerve?
Sacral.
Have you turned it off completely?
No, not yet. Yeah.
You won't know. I mean, they told you you could turn it down. They told you you could turn it off.
Yeah.
So
maybe I'll do that.
I mean, the symptom. So guys, for everybody listening to this, now listen. When you experience an adverse event that is interfering with your quality of life, that's giving you more pain, that is when you have to stop and go, okay, number one, what the hell is going on? Why am I having this side effect? And number two, especially for something like InterStem, which is working with nerves and is working so close to your spinal cord, there's not a lot of wiggle room here there.
It's just frustrating because like the trial, I didn't have any side effect at all. Like I didn't, it was painful just from getting it done.
Yeah, but you could have a post-op infection. That's common. Like the number one side effect that there's a ton of people who, you're okay with the trial, but as soon as they do the implant, things start to go wrong. And if you look at the MAUD database for InterStim, deep tissue MRSA infections from the implant is like the #1 side effect.
Yeah.
Is it swollen?
No.
Is it tender to touch?
And it's not tender to touch. No.
Are you getting any shocking feelings? Or is it just this pressure?
No, see, the only feeling that it's like that's really annoying is like all of a sudden, it's kind of embarrassing, in my rectum.
Mm-hmm.
It'll just all of a sudden feel like something just jabs me from the inside.
Okay, so I had another patient I was working with who had exactly that symptom.
Mm-hmm.
And it was so painful that she actually was afraid to have a bowel movement, because every time she had a bowel movement, she got that shocking sensation. That is not normal. You are having a malfunction of this procedure.
Okay.
Okay, it is never supposed to hurt, and and you shouldn't be. I just had somebody else did the ankle stimulation, the urgent piece. It's now, but it's the same thing. It's neuromodulation of the nerve, only they do it at the ankle. And look, I just got a message on somebody. What is this? Okay, hold on. So what that doctor told me is it should never hurt. If it hurts,
Yeah.
there's a problem. If it hurts, you always reduce it. It should never give you any significantly painful or distressing symptoms. So he had it done, and the person who did it was trained incorrectly, and they told him, you got to take as much pain as you can take. Turn it up as high as you can tolerate it, and leave it there.
Right.
And the guy, he had a seizure. They turned it so high, he had a brain seizure. And
Wow.
now he's got some neurological damage from something that was turned on too high. So, I can't give you medical advice. It's
I
not
know.
my place to
I
give
know.
you medical advice, but they told you what you can do.
Yeah.
And if I were having that symptom, I would be turning the damn thing off until they looked at it.
Okay.
Right? Or at least I certainly wouldn't be turning it up and down and up and down and up and down until they
Yeah.
have an opportunity to study what was going on.
Yeah, I haven't gone up since I started having the symptoms, but I have gone down. But you're right, I should just go ahead and turn it off at least till I talk to them. And
Yeah.
I do have a question about the subtyping.
Yeah.
Can you have more than one subtype?
Absolutely. You will have more than one subtype for sure.
Okay.
If you
Just
got
listening to Shirley when I was 13, which oddly enough was 1993, that's when I was diagnosed as well.
Yeah.
They did the cystoscopy and said that it looked like somebody had gone in there and used an emery board on my bladder wall because the lining was just deteriorated.
Okay.
So they don't know how long it had been like that, and it did eventually. They did DMSO, and Elmeron and Cardura, and between those medications, my wall did end up building back up.
Okay. I would suspect some sort of chemical irritant. Again, we talked about well water, contaminated well water earlier.
Yeah.
That would be very interesting to see if that was involved, or if you were drinking a lot of soda or cranberry juice or artificial sugar or stuff like that, or if there was some
Yeah,
sort
I've never been on well water, but I did live in a city that it was just all agriculture.
Yeah.
So I'm wondering if perhaps it's really interesting hearing the different things, because all I've ever known is that I've had it. And, it's like, because I was a child or a teenager, it was just, okay, my parents told me that I had to follow what the doctor said, and they just went with what the doctor said. And I didn't really ever have education on it.
Well, and they weren't really good about asking the whys, and really taking the time to explore the whys. How could this have happened? Ketamine exposure would have done this. A chemical in the home could have done this. The bladder can be injured just like any other part of the body, and clearly you suffered a bladder injury of some type. or maybe you had an infection. Something. All right. Facebook, seriously, our feed on Facebook is terrible right now. Guys, I'm so sorry. I don't know how to fix it. Yikes. All righty. Okay, hon, you have homework, and that is you better
I
call your
do.
doctor first thing in the morning, and you need to
I
let
will
them
do.
know, and let them know about the headaches, let them know about the sharp pain in your rectum, and if they have the audacity to tell you that that's normal, it is absolutely not normal. And
Okay.
I had another patient, that other patient who had the rectal pain, I had her call the company, the patient assistance line at Medtronic, and they confirmed to her that there should be no symptoms in the rectum, none. Okay?
Okay.
Okay, hon.
Thank you, Jill.
Good luck. Keep me posted.
Thanks. I will.
Okay, let's go to Cindy. Cindy, are you there?
Yeah, I'm here.
Hey, girl, how are you today?
I'm good. I'm good. I just like the last lady that was on, when you mentioned childhood, it kind of triggered something, and I wasn't going to come on today, but I thought, hey, yeah, why not? I had the Hong Kong flu when I was 11,
Mm-hmm.
and my primary care doctor actually asked me about what virus, serious. I mean, I almost died from it when I was a child. And after that, I started like having urinary tract, like I'd pee my pants in school.
Right.
Or at night. And I just wonder if my whole entire life has been from that Hong Kong flu.
It's, I mean, with this new information about small fiber polyneuropathy and the fact that these small fibers can be damaged with viral infections, it's possible.
I don't know how this primary care doctor actually figured it out and found it like on my records. She's like a bulldog. She's great.
Yeah.
But yeah, that just kind of triggered
Well,
that.
I mean, think about the COVID long haulers right now. We have people, in fact, that famous actress on Dynasty, Emma Sams, is a COVID long hauler. They just featured her in People magazine. And we don't understand the mechanism of what's happening in those patients that is giving them these long-term symptoms. Does it mean that they're having still active viral infections in different parts of their body, or instead is there some sort of damage that has occurred to their nervous system or something else? I mean, I think that that's no less possible than some of the other things.
Right. Yeah,
I
just interesting.
It is interesting. Where there's just, I mean, like on one hand, when I look at my life and I look about the limitations that I've had in my life with all this chronic overlapping pain that started at such a young age, there is a really palpable grief, like that we didn't get to have the normal life of somebody who wasn't living with us.
Right.
And they didn't face the criticism that we have faced, and they didn't face the endless nights up all night peeing or crying in pain, or the begging for pain relief, or just wanting somebody to give you a hug, right?
That feeling right now, like my family doesn't really, no one even really checks on me.
Yeah.
And no one truly, I mean, other than individuals who have been through this, really understand. And it's difficult. I mean, there's
I agree.
no way around.
I agree. And I catch myself fairly regularly. I have that moment of, it's not anger and it's not, but it's like a little bit of bitterness.
Yeah.
And it's a lot of grief about the lost opportunities.
And I
And
remember when I was at work, a lot of times if I'd hear somebody like flipping a can of soda, a drinking a Pepsi, and I would be like, that's just how, you just get like angry, like,
yeah.
you know, I can't do that. Why are they, why can they
Why
do
can they
that?
do it and we can't do that? And you know, I truly believe that that there are a lot of man-made problems that have created a lot of issues for us. Regret. Sharon says regret.
Yeah.
Yeah,
It's
it's regret, and it's see, like I'm like totally there with you right now, and I it's hard to describe what it feels like, except I want to be included and involved with my family, and I want oh, there's your cat.
dude, can you see my dog?
Oh, how adorable. Look at that. This dog. Oh,
He's right. I laugh. Yeah, my cat and dog, but they're my family.
yeah, exactly. Exactly. Well, here's the thing. You know what the gift of a support group is? Is that you and I understand each other.
Yeah, which really, really helps. And you know what, Jill? I sent for Clear Track and I sent for that white chocolate drink. You guys are fantastic. They were here in no time. I'm truly grateful.
Well, we're always looking for stuff, but even we were born that we would have a life where we would never be hurt or injured. And in the context of all the potential things that could have happened to us, there are so many other things that would be so much more devastating than having this. And so
Right.
having that sense of of gratitude, I think is part of it, but what's even more important is recognizing the other people in your life who are having those same feelings and reaching out to them and helping them. When you start helping others, you focus less on yourself.
Exactly. Exactly.
And that was really one of the things that really, and when you start helping others, it gives you context. Like before I started my support group, I thought I was the worst IC patient in the country.
Mhm.
And then after I started my support group, it's like, oh, wait a second. Gosh, I have it good compared to some of these other patients.
Yeah.
And when I saw that, it was amazing how that changed my state of mind. So I
For
also
sure.
I also think that I also believe in God and I have faith and I think that things happen
Oh,
for a reason. So
yeah, me too.
I'm going to run with that. But girl, we are sisters and IC forever.
I appreciate
And
that.
if you ever need a
You know,
pep talk, and if I need a pep, you know me, I'm willing to talk about anything. There are moments when I am exactly where you are. And I say, let's just nurture each other and support each other and pray for the day that we can all get together and give each other hugs.
yeah, I can't wait.
And I just want you to know, listen, you are not an abnormal person. I am not abnormal. We are normal people in an unusual situation. And
Right.
it's important you keep telling yourself that you are a beautiful woman. You have a beautiful spirit. You have things to give to this country. IC does not change your ability to love or to be loved. It does not change your ability to be a friend. It does not change your ability to love that beautiful dog laying on your lap right now. Don't give it, oh, look at that. Don't give it more power in your brain, you know, and do the things you love. Oh my God, look at your cat.
Look at
You know,
right.
let's start building those other parts. People ask, what would you do? What would you do if you didn't have to work and you won the lotto? What would you do? I know what I would do. I would probably get my PhD in something. I don't know, microbiology or something. But I would also take painting classes. And I think we have to listen to what gives us comfort on the inside and follow that. Follow that and just let it unfold. Let God speak through you in whatever way that is meaningful to you and can give you comfort and help those people around you at the same time, right?
Absolutely.
All right,
Thank
hon.
you.
Big,
Love you.
big, giant hug. And I love that shirt you're wearing. That's one of my favorite colors right there.
Right. All right. Well, thanks for talking to me. I wasn't going to take anybody's time, but I thought, why not?
You're fine. You're fine. We all need this. All right. Okay.
Hey,
And our last person is it Julianne? Did I do you? I'm sorry. or did I not?
No, Jill, how are you?
Okay, there you go. I'm sorry. But the screens on my head on my screen, I have little boxes with your names and they kind of confuse. Girl, how are you feeling today? I'm looking at a face that looks like it's a little bit on the frustrated side.
I am a little frustrated, but I'm doing great. I landed a full-time job working at
Woohoo!
a doctor's office.
Okay.
So I work 6 out of 7 days a week.
What?
Yes.
How many
I
total?
work Monday through Saturday.
How many hours a day?
Monday through Friday is about 9 hours a day, and Saturdays is 6 hours.
Are you getting paid hourly or salary?
Hourly.
Okay, so you're going to reap in some good money. I guess the question is your body up to such a big rigorous schedule?
My body is fighting with me.
Okay,
I can definitely feel the bladder pressure and the discomfort maybe like 5 to 6 hours into my shift.
Okay,
And that's when
are you sitting or standing at work?
I'm sitting.
Okay. Okay.
So I usually pull out the azo numbing pills a few hours into my shift
Okay.
to help with the pain and discomfort.
So are you sitting on a good chair or a questionable chair?
A questionable chair.
So I think one of the first things that I would do is maybe get a chair cushion that will relieve pressure on your pelvis.
Okay.
That would be number one. And the cushion, let's see. Where is it? Where are my cushion samples? Okay. So you want a cushion like this where each butt cheek is supported, but there's a groove down the middle, so nothing is pushing up. So this is the travel cushion, right? And so and look at how cool it is, right? I mean, it's just so perfect. Great fabric, really durable. It'll easily last a year. The company also makes a U-shaped cushion, and they're going to be in the $70, $70, $80. So that would be one. The other thing you could do, as Lisa says here on YouTube, is you could sit on an exercise ball, and there are ball chairs. They're just a little bit hard to get used to. You have to have a good core for that, but no, not at all. Do you have for a long period of time? Are you getting pain anywhere aside on the left side, on the right side, by your urethra, by your rectum?
I feel the pelvic floor like tightening up, and after a little while I have to like get up and move around for a little bit and then try to sit back down. But I can tell you that I come home and I have to do my suppository every night.
You have to do your what every night?
My volume suppository.
Okay. So vaginal volume suppository, which is a muscle relaxant. Have you been on the job for a week now?
I've been on the job for a week now, yeah.
The other thing you could do is your desk a sit-stand desk?
No, it's all in one desk, so there's like 3 or 4 people at the desk.
Okay, so you got people next to you who are sitting answering the phone or doing billing or whatever?
Yeah.
So they make a little stand that you can put underneath the computer and raise it up. So you don't have to change the desk height. You can just change the height of the monitor and your work area. I don't want you to don't be disappointed or dismayed right now. This is about you finding your comfort zone. The great news is you got the job. Now we got to figure out how to make your body like the job. And so whether you can discreetly stand up for a couple minutes every 30 minutes. Just stand up, move
Okay.
around, stretch out a little bit. Try to what are you drinking in the morning?
I just drink water.
Okay. I would want to do chamomile herbal tea or peppermint herbal tea because that's a nice smooth muscle relaxant.
Okay.
Okay. Are you taking anything else other than your breakfast in the morning? Do you take any pills, any supplements, anything like that that can be irritating?
Let me see what I have. I know that I bought the bladder control medication by Azo.
Okay. But are you incontinent? Because that's for incontinence.
No.
Then why would you take that?
I do, because I do feel like the constant urgency for having to use the bathroom, and there's times that I do go and I don't use the bathroom.
Are you wearing a pad during the day? Are you wearing an incontinence?
No.
Would that help you to have the comfort of a pad there just in case?
Most likely, yeah.
So there's no shame in that, I mean, it's okay. The one I just got from my mom, let me show you. Yeah, good. And
Mhm.
listen, I leak too. There's no shame. Hold on. These are chlorine-free ultra thin pads by L, the company L. And let's look at this for a moment. So she's taking this for people watching. She's taking the Azo bladder control with Go Less. So let's see. So it's got pumpkin seed extract and soy germ extract. Maltodextrin. You know what I think I would be tempted to do is not do this for a week and see if that makes a difference. I don't know the soy germ extract, soy can be irritating for some people. And so maybe that's triggering you a little bit.
Okay.
I mean, what do you normally eat for breakfast?
I usually eat like a ham and cheese sandwich or hot ham and cheese sandwich.
One you're making, or is it frozen?
No, it's one every day.
Good. Okay. Is it uncured ham?
Yes, uncured ham.
Okay. Okay. What about what are you drinking when you get to work?
I just drink water all day. It's filtered water. It's like one of those big gallons.
Is it a Brita water filter?
No, it's like one of those standard water filters.
Okay. Well, so either your bladder wall's getting triggered or your pelvic floor is getting triggered, and it's hard to know which is which. You're just in that getting used to it phase.
Yeah.
So if the Azo bladder pain relief tablets are helping you, that's great. I would be looking at good ergonomics. My rule here, sitting here in my office, is as soon as the phone rings and I'm on the phone, I stand up and I walk around a little bit. And if I'm doing coaching, I will walk all over the place. Try to get up and move around a little bit if you can, okay? Just to try to help those pelvic floor muscles. And, Sharon says, I feel for her. It's very hard juggling a work day while you're uncomfortable. The other thing I think I would be doing is PEA for pain relief. I mean, the bladder, if you do something with chondroitin in it, that will help protect the bladder wall. That's why this is pointless for somebody with kind of IC bladder sensitivity, right?
Okay.
What's more successful is something that's going to have chondroitin in it to protect your bladder wall combined with PEA that will help reduce pain potentially. So I would be more inclined to either do the bladder builder or just the Peora, which is just a pain fighting agreement. No reported side effects in the IC study. And in most studies, no reported side effects, very well tolerated. Pretty good for calming nerves down, neuropathic pain. So maybe try one of the different supplements too. But something with PEA in it, I think would be potentially the most helpful in getting you through that pain at the 4-hour, 5-hour mark.
Yeah.
Okay. What shoes are you wearing?
I am wearing some non-slip support shoes, so they are memory foam.
Okay. And do you feel like you're walking well in them?
Yeah.
Okay. So the other shoe, the shoe that I recommend to everybody is, which I just accidentally untied, are Hoka's. And they make them in white. Sorry, these are kind of dirty. These are lavender. But these Hoka One or Hoka 11 are fabulous shoes for standing and walking all day. Massive cushioning, great support. I can't wear the typical SAS support memory foam ones at all. I can wear these all day, every day. I mean, I got 4 pairs and I'm ready to buy a couple more pairs. This is all I want to wear. I don't want to wear high heels anymore, anything. This is what I wear. So look at your shoes too, and maybe think about the Hoka One. These are the Bondi 6s, which are the Bondis, which are the ones that have the best padding for standing. Okay.
Okay.
Okay, hon. Well, keep us posted. Listen, believe in yourself. Just believe you can do this. And if they're kind and supportive and they're willing to work with you, great. Remember that when you're under probation, they're evaluating you, but you're also evaluating them. And you need to be asking for how long are you on probation for, like 30 days, 60 days, 90 days?
90 days.
Okay. So in this 90-day period, not only are they evaluating you, you really need to ask yourself, are these people worth your life and your time? And if they're not, if it's not a nice place to be, if it's not a happy place to be, if you're not getting the support, start looking. Because you shouldn't suffer in a job you hate for a couple of years with people that are treating you poorly. You can move on. Okay?
Okay.
All right, hon. Big giant hug.
Thank you.
All right.
Bye.
I'll look forward to hearing I want to hear how you're doing next week, okay?
Yes.
All right.
Definitely.
Okay. I'm going to shut down the Zoom. We're done with Zoom. Goodbye, everybody. Be well. All right. The Zoom meeting is over. I am now back on the incredibly erratic Facebook, YouTube. Just out of curiosity with YouTube, have you guys noticed it coming off and on, off and on? Have you guys been seeing freezing of the screen like Facebook? Baffling. Sharon says, I'm a 2nd grade classroom. I have the same issues. I'm ordering the supplements. It's so stressful not knowing if you'll have pain that day. Yeah, I just think that the more we dive into the research with PEA, the more exciting it is. I found a case series that was published a couple ago. Let me find it. Let me see if I have it here on this computer. This is my streaming computer. That's my work computer. Let me see. Oh, by the way, oh my God. On Twitter, do you guys know, if you follow a guy, Dr. Glaucoma Flecken? Like glaucoma Flecken? He's an ophthalmologist who is also a comedian, and he is hysterical, and the doctors love him. And so his series right now is on residents, because this week was match week for kids going through medical school. They get to the point at the end of schooling where they then get matched to their specialty. And so they basically decide what specialty they want to be in: urology, gastroenterology, pediatrics, neurology, pathology, whatever. And then they have their list of not schools, medical centers or community or universities where they would like to do their residency. And so John Hopkins, Stanford, whatever. And so this is the week that they got their match results. And lots and lots of people got their matches. And then what I didn't really understand is that some students don't get their matches. Imagine they don't get matched at all, and they have to reapply 6 months or a year later. And it's devastating for them that they've got all of this school, they put all of this time in, they're getting good grades, they want to practice neurology, but a neurology center won't take them. So then they have to take a step back and go, okay, I guess I have to instead go into pediatrics. And then they try to And so this whole emotional thing with the doctors. Anyway, so Dr. Glaucoma Flecken on Twitter is doing the first day of a new resident in every department. So first day cardiology, first day pathology, first day psychiatry, first day children. It's hysterical. So he did his first day urology. And let me see. His face is great because he plays all the characters. Let me see if I can play it for you. I mean, I can't share it, but I can do the audio. Here, hold on. Let me see if I can find it. It's so I've been whispering him, do urology, and of course he has a 500,000 subscribers. So, oh, come on, Twitter. Not like he ever reads my stuff. I'm sure he doesn't. But anyway, we have been waiting for him to do urology, and oh my God, gynecology was hysterical because the med student was asked to deliver a baby on his first day. The med student goes, I don't think it's going to fit. And the doctor goes, we've been doing this for thousands of years. It will fit. The baby will come through. He's just so spot on. And reading the urology comments is absolutely hysterical.
I am the new meth.
Okay, so
I'm
here.
not high. I'm the new meth.
Okay, I'm going to play it for you.
What up is?
Okay, wait, hold it. Wait. I'm going to play it for you.
I'm not high. I'm the new meth. Wait, you stuck a what up is? A top hat? Oh, one of the little pieces from Monopoly. Oh, okay. Yeah, no, anatomically that makes a lot more sense. Yeah. Okay, I'll be by later. Okay, bye. Hey, come on in. Does that happen often? No, it's usually either the wheelbarrow or the rocking horse. No, I mean sticking things up the, Oh, yeah. As long as there have been penises, there have been men willing to stick things up into them. Oh, I think I'm going to be sick. You're going to be fine. We actually don't examine that many penises in urology. Really? No. We see so many penises, like an aggressive number of penises. Hey, doc, sorry to bother you. I got a consult for you. Bill, come on, buddy. None of us can get the Foley in. Nurses, residents, med students. Well, what about that guy? That's Tony. He's with maintenance. Yeah, he can snake a drain. I'm not high. I'm the new med.
I'm sorry. That's doctor humor, but it's hysterical. Anyway, Dr. Glaucoma Flecken on Twitter and on YouTube, you have a whole new insight into what doctors go through. And that urology segment's absolutely hysterical. I wish you could see his face. He's so good at it. He's such a good actor. All right, YouTube, what the hell happened to you? I got to find my YouTube again. There you are. Okay, Linda says YouTube's frozen only once, whereas Facebook's freezing every 5 minutes. Crap. Angela says she's having bad bladder pressure. Nothing is helping at all. So, Angela, we have a flare management kit on our website. If you just go over to icnetwork.org, there's a whole section on managing flares. But if you sign up for our newsletter, you get a 40-page flare management guide with an hour-by-hour rescue plan to tell you what to do. So if you're having a typical bladder wall flare, let's say you had a soda or you had a coffee and it really triggered your bladder. The first thing you're going to do is you need to drink water because we have to try to flush the acids out, right? And so make sure that you up your water intake. Don't go over the top. This is not about drinking gallons of water. Drink your normal 6 to 8 gallons of water. The challenge here is a lot of people associate drinking anything with frequency, so you stop drinking water. The problem is when you do that, you concentrate your urine and your urine becomes more irritating. So we have to flush the bladder instead by giving it some fluid. So drink a glass or two of water. Let's try to flush things out. The second thing you can consider doing is alkalinizing your urine. And that means if you ate something really acidic, if we put something that's alkaline in there, it's going to help to reduce the acid. And the perfect example is right here, Pre-Leaf. Pre-Leaf has been around for years. It's an alkalinizing agent. It's a calcium glycerophosphate. You take 1 or 2 pills before you're going to eat something acidic, and it might reduce some of the acid irritation. So during a flare, you could potentially take 1 or 2 Pre-Leaf and see if that helps reduce the acid. Or you could take a Tums, or you could do like a 1/4 teaspoon of baking soda in a big glass of water. You don't want to do a lot of baking soda because baking soda is sodium, and that would raise your heart rate and your blood pressure. So that's an old approach. It's kind of an emergency approach that was popularized by Dr. Larry Gillespie in her original book on cystitis years ago. If an hour or 2 later, after alkalinizing your urine, it hasn't working, the next thing we would consider doing maybe is something that will numb your bladder wall. And that's going to be azo. Azo you can get in any drugstore, and it's the over-the-counter version of pyridium. So this is the stuff that turns your urine orange. And what it does is it acts to numb your bladder wall. But before you do this, you might want to do this. Do a quick dipstick test of your urine just to make sure you might not have picked up infection. Now, remember, everything feels like infection in the bladder. Your bladder only has 2 nerves to tell you there's a problem: frequency, urgency, or pain. So everything feels like infection. A bullet wound, a stab wound would feel like infection. A fungal infection would feel like a bacterial infection. But there are moments when people do I've had 2 bladder infections in the last 25 years. And so doing this first off would be particularly helpful, because if you have a double positive, a positive leukocyte and a positive nitrite, then yeah, you got infection. And so you would be able to call your doctor tomorrow and go leave a urine sample and say you have a double positive and you'd like to get your urine checked, right? So do that before you do the azo pain meds, because once you use the stuff that turns your urine orange, it kind of messes up the dipstick test. So at that point, you got to give the azo a couple of hours to work and see how you do then. If you're not getting better, that's when we obviously want to perhaps be using some Tylenol or Advil or even Norco. If you happen to have that in a small amount, might be helpful. If none of those self-help things work, then you want to call your doctor and say, hey, could we consider a rescue installation? Because a rescue installation, what it does is it puts lidocaine directly on the bladder wall and it turns the nerves off. It's called a rescue for a reason. It rescues you out of a flare. And so for that flare that isn't improving after a couple of days of you riding it out, then we want to look at maybe doing something like that would help calm those nerves. And then we got to be real. I mean, now listen, some of you, you don't believe in diet management. And I can't tell you the number of people who are still drinking. You're having bladder pain every day. You're flaring every day. And you're still, damn it, I'm going to have my cup of coffee every day. Your bladder can't heal if you're giving it coffee every day. It simply cannot heal. And so you have to create an environment that will support healing. And that means you can't pour acids or alcohols or things like that on your bladder for a couple of months to really give your bladder an opportunity to heal any damage that's happened. So flares are real. You can get our, again, you go over to icnetwork.org and sign up for our free newsletter. A pop-up window will happen and you'll get an email with the link to download our flare management guide. All right. All right. Well, I tell you what, since the stream quality is particular, okay, so Letty says the lidocaine burns me very bad. So some people are sensitive to lidocaine, and if you are, they can swap it over to Marcaine, and it would be very interesting to see how you did with Marcaine, okay? Shell says she would love to go to nursing school. Yeah, totally. I mean, I love my job. I love what I do. I really wanted to do my PhD and I couldn't do that because of my IC, and I would still like to do that. I just can't afford the $100,000. I need that in my retirement fund because I'm not a kid anymore. You know what? I got to have money to live on. I have to save every penny that I can now. 'Cause there ain't no pensions when you're in the IC business. Nope. All right, guys. Well, listen, last call for questions. Any last questions? I'm sorry the screen quality is so bad. Very odd. It's really, really odd. I'm going to have to call them tomorrow, see if we can figure it out, because we have had a couple of glitches on YouTube. Not as many, but some. Okay, so here's your homework. For 15 minutes a day, I need you to do something that will soothe your spirit. You know, this is hard. We're all going through very hard, stressful times right now. For 15 minutes a day, let your cat sleep in your lap, let your dog sleep in your lap, read a beloved book, talk to somebody on the phone, give yourself some joy and some peace and some tranquility. For 15 minutes a day, I need you to do something for your bladder or your pelvic floor. Get down on the floor and do the damn exercises they gave you that you don't want to do. Get the freaking wand out and do the wand. Arlene says she'd like to do the PhD. I know, it's crazy. For 15 minutes a day, I need you to do something for your noggin. Let's get some knowledge up. Facing pelvic pain. Again, now listen, I have 10 copies to give away. I'm going to be giving them away this week. If you would like a copy of this book, and this is not the cheap copy. This is the beautiful full color copy. I've got 10 of them. All you need to do is send me an email, icnetwork@mac.com, with your favorite flare management tip. What do you do to help your flares? So I need a flare management tip. I need your address, your mailing address, and then I need you to mail it to me, icnetwork@mac.com. Okay. Also, just as a reminder, over on the IC Network, even though it's not publicly said, we are doing a rare sale, 15% off of everything, including the supplements. And the coupon code, write it down right now, spring15, all lowercase, no spaces. So the word spring and then the number 15 will get you 15% off of your purchase. So Sharon's saying, I'm wondering, Bladder Builder, what's a first supplement to try? So it begins with your sensitivity. If you're somebody, you're afraid to do stuff because you feel like you react to everything, right? And that's me. I'm very, very reluctant to take stuff because I know my sensitive body overreacts crazily. We would probably suggest if we're dealing with estrogen atrophy, IC subtype 2, the cleanest, pristine formula that we have with the fewest ingredients that could still make a difference is called Bladder Rest. And it comes in an avocado oil base rather than a olive oil base. And so Bladder Rest is kind of the formula that for the people super sensitive. If you can eat yogurt and you don't flare and you're a little bit more adventurous and robust, Bladder Builder, which I do believe is the top supplement right now, is the one that we would try. But with all of the supplements, understand that the most common side effect is stomach upset. And the worst mistake you can make when you try a new supplement is take a full dose the first day. Man, you got to start slow. One capsule, see how you do. That's why I always ask the companies if they have samples, and none of them do right now, which is really sad. So it's going to be a $50 experiment when you try a supplement. So you start with one capsule, wait 24 hours, see how you feel. One a day for a week, see how you feel. And you can work your way up to the manufacturer's recommended dose. But just understand that a lot of people never go past one. They're fine with one a day. It works for them. So don't assume that you've got to go to 4 a day or whatever. So I put Bladder Rest if you're sensitive, Bladder Builder if you're not sensitive. If you prefer the Cysto Protect formula and you used that years ago, then I would do the Cysto Men because basically it's the only one that we have that's matched that formula. If you're IC subtype 3, IC subtype 4, IC subtype 5, where we're looking more at nerves and trying to calm nerves down, I would be doing the Pura, the PEA, the palmitoethanolamide, where there's so many research studies with sciatica and burning mouth syndrome and IC and fibromyalgia showing that palmitoethanolamide is remarkably successful at reducing pain. It takes a little bit of time, but it does happen. And again, I did find that case series. I'm going to feature in an article on our website, and it was stunningly good. Let me look at my history real quick. When did I have that open? I think I had that open Friday. Let me see if I can find it here. It's been tested with carpal tunnel syndrome. Let me see if I can find this. I mean, I really want to dive into the science here. Yeah, here it is. Here it is. This is in the Journal of Pain Research. And they're studying it in nerve compression syndrome, sciatic pain, carpal tunnel, diabetic peripheral neuropathy, post-herpetic neuralgia, axonal neuropathy, failed back surgery, dental pain, neuropathic pain and stroke and MS, low back pain, vaginal pain. It is an endogenous modulator as well as a compound of food. No serious side effects have been reported. No have there been any drug-drug interactions. This article presents case series describing the application and efficacy of PEA in the treatment of various pain syndromes. It's not quite the one I was looking for. But anyway, there's going to be a lot more on that in the future, guys. Sharon says, Shell, I wonder if the supplements are approved to use with FSA funds. I don't know. I mean, if it's a credit card, you can always try it in our store and see what happens. I just don't know. Sharon says, right, samples would be great. I have to find my subtype, seeing my OBGYN for this week for estrogen, and you have Hunter's lesions. Yep. Yeah, because Hunter's lesions require lesion-specific therapies. No doubt about that. You're wasting your time. Mickey says, wish me luck on Thursday as I have a double hydrodistension, fulguration, and biopsy. What's a double hydrodistension, hun? I don't know what that is, Mickey. What are they going to do? A double hydrodistension? I don't get it. So let me just summarize what I started the meeting. Remember that we were talking last week, in the last couple of weeks. Mickey says, my urologist just blows my bladder up twice. Okay, as long as it's low pressure, short duration, it shouldn't be high pressure. Hopefully he's not using high pressure. It's because the AUA no longer recommends that because bladders can rupture. So as long as it's a low pressure, short duration, I guess. So remember now that since last fall, we've been talking about chronic overlapping pain conditions, IC subtype 5, central sensitization, chronic overlapping pain conditions. Why do some of us get IC and IBS and vulvodynia and prostate pain and TMJ and migraines and fibromyalgia, et cetera? What is that all about? And of course, now we know that that is a central nervous system disorder, that the central nervous system has been sensitized. Nerves have been sensitive. They've been either damaged or you've inherited a nervous system that is just simply easier to turn on. And so now we know what part of the nervous system is driving the skin sensitivity and the bladder wall sensitivity. And these are called small fibers. These are the fibers that have the smallest diameter nerves in our human body. And these are fibers that are in the surface of our skin. They're responsible for communicating temperature and pain to our spinal cord and our brain. And we also have small fibers in our bladders and in our bowels. And so there's now a belief that something called small fiber polyneuropathy is what is driving these symptoms of why a minor touch might be more painful, why a little bit of urine in the bladder makes you feel like your bladder's very, very full. So neuropathies happen after a number of common events. If you, for example, have diabetes, uncontrolled diabetes, that can damage nerves. If you have had Epstein-Barr or herpes or HIV, that can damage nerves. What's far more common in the IC patient is low B12 levels. And it's stunning the number of patients who have tailbone injuries, and it's stunning the number of patients who report that when they do blood testing, they find very, very low B12 levels. My levels were very low. And there's a reason for that, and I don't need to get into that now. But we also want to look at heavy metal exposure. We want to look at, if you've been in industry where you've been exposed to pesticides or exposed to mercury, things like that. Or if you've been exposed to a medication that can trigger nerve damage, again, like chemotherapy or even some antibiotics. So what's exciting about this small fiber polyneuropathy is there are more and more research studies finding this in pelvic pain patients. And the study that I cited earlier, over 2/3 of patients in the study with IC and IBS and pelvic pain had small fiber polyneuropathy. I'm sure I have it. I have no doubt that I have it. So how do they establish that you have it? That's where this is really, really exciting, because they just do a skin biopsy down by your ankle. They just take a millimeter piece of skin, send it off to a lab, and look at the nerves. What this is objective proof that you have a nerve. How can we use this? We can use this when you say you need help with pain. They can't say, well, it's all in your head. You're going to say, look at the biopsy results. I've got small fiber polyneuropathy. They can't say, well, it's all in your head. You're going to say, no, here's the proof. My nerves are, it's being driven by my nerves being dysfunctional. They can't say, well, you're not eligible for a disability because there's nothing wrong with you. You're going to say, well, look, here's objective proof that there is something dysfunctional about my nerves. We now have an objective test that can go into your medical records that can prove why you might need pain care. They can no longer say it must be all in your head. That's been a barrier for decades, is having an objective measure of what could be wrong. Now we have it, a simple frickin' skin biopsy. Now, saying the word small fiber polyneuropathy, that's a little scary. Don't be scared by it. Don't be scared by it. It happens. Nerves can, just like muscles can be injured, and just like feet can be injured and bones can be injured, so can your bladder and so can your nerves. And so what we want to do, number one, is if you feel a lot of tingling, a lot of skin sensitivity, call your doctor and have them check your B12 levels. Because if your B12 levels are low, then that's going to make your nerves more sensitive. They can just get you back on B12 vitamin supplementation. If your copper levels are low, they can give you a little bit more copper. Or if you're taking too much B6, B6 is nerve damaging. So the odds are that a lot of us have just remarkably low B12 levels, not only because we're getting older, but because our freaking diet has been limited for so long. And the challenge with B12, a lot of it comes from seafood. And if you hate seafood like I do, well, you're screwed. And so using the supplementation is viable, but don't just do it. Ask the doctor to measure, take your blood, and let's see what it finds. Data matters, facts matter, science helps. Let them look at it and see what they find. If that comes back negative, but you still have symptoms consistent with, sensitive skin, pin pricking, feeling hot, feeling cold, your bladder looks normal, but you still feel full, things like that, they're going to take it a next level, and they're going to do more testing. They might do 24-hour urine collection to see if we've got a heavy metal exposure. They're going to want to look at all the medications you've had to make sure you're not on a medication that could damage nerves. As I said, I took one Bactrim GS and my ears started ringing, and they've never stopped. One pill caused nerve damage in my ears. One freaking pill. Okay. And then therapeutically, this helps us focus our efforts on what we need to try to do. If you've got sensitive nerves, our therapeutic priority is to calm your nervous system down. So how do we do that? Number one, we get rid of the irritants. We get rid of the provocatives. And the odds are, for those of you who have this, you're already doing that. You don't use scented candles in your home. You don't use Febreze in your home. You've gotten rid of the chemicals. That's important. We have to calm. Okay, Annie just here says, I have small fiber polyneuropathy. They took a skin biopsy at my ankle. So Annie, what did they tell you about that now? How are they giving you any new treatment recommendations? I would love to hear what they told you about this. So again, number one, we want to try to get rid of anything that is tweaking your nerves. So if B12 is an issue, we got to get that level up. If B6 is the issue, we got to get that level down. If you're doing caffeine, for God's sake, stop, because caffeine is neurostimulatory. It's only going to turn your nerves on and make them potentially more sensitive. And then therapeutically, this is where medications that can calm the nervous system down have a place. So using that low dose antidepressant might help, like the Elavils, or better yet, one that is not an anticholinergic. Or you can go for the anti-epileptics like Neurontin, gabapentin. That will calm the nervous system down. And again, the great thing about the data and the biopsy results is, for those of you who struggle with pain, you can say, look, here's proof why I'm in pain. Can I please have some pain medicine? And they might be willing to give you a little bit more pain medicine. Annie said, they gave me some meds. It didn't really help. They took tons of tests for the autonomic nervous system, which is dysregulated. Did they do the chair tilt test? That's where they lay you on a bed and they tilt it backwards, and they're kind of, because sometimes when you have small fiber neuropathy, you have orthostatic hypertension, where you go from sitting to standing and you feel dizzy. So Annie even tried the IVIG infusions, but you had too many side effects. Annie, I'd love to talk to you off stream sometime about this. This is what about this is where I think you should ask your doctor about PEA, palmitoethanolamide, which the research studies are using with the conditions associated with small fiber neuropathy. So PEA is derived from fat. It's no known side effects, no known drug. Well, one study had side effects, but the great majority don't. No known drug interactions, and it appears to be the most successful at reducing nerve-driven pain. PEA. So I think that this is worth a lot more exploration, and I'm going to try to do more research into it. But you can do that yourself. You can just go to the National Library of Medicine and Google PEA, or you can get the scientific name, palmitoyl ethanolamide, which you can pull right off of our store. You can copy and paste it. And take a look at these studies yourself. But I mean, I think it's very, very, very encouraging. I'm excited about it. That's one of the things that I do when I start feeling kind of a more skin sensitivity is I do use PEA. Hello, Katie. Nice to see you. So Mickey said, you're just getting over shingles. All the chemicals for doing hair 37 years, I'm sure poisoned me. Man, that's right. Just like dentists who are exposed to so many chemicals doing dental work have an extremely high cancer rate. Dentistry is rough. Imagine drilling out and that's vaporizing mercury that you're then breathing in. It's no wonder my beloved dentist died of lung cancer. So vaginal Valium would relax your pelvic floor muscles. I'm not sure what your question is there. I think it's absolutely fascinating. Barbara says, going back to the urologist next Friday, she saw blood microscopically in your urine for the second time in 1 month. Can this also be from IC? She also has me worried it's bladder cancer. Almost all of us have microscopic blood in our urine when you've got an irritated bladder, and I can explain that. So hold on, let me get my. So this is one of the great interesting facts about the bladder, right? So the bladder is the only organ in the human body designed to hold toxic waste, right? It's basically a bag, it fills up with urine and then you pee it out. But urine is toxic waste. Urine is your body's refuse. So how does the bladder hold potential irritants for hours at a time and not get damaged? And the answer is that your bladder is like your mouth. It's a hollow organ covered with a thick coating of mucus. So this blue area, obviously it's not blue. This blue represents this nice, thick outer coating. And then underneath that, we have 4 to 5 layers of urothelial cells. Okay. And these are the largest single cells in the human body. And they have something called tight junctions. If you look at these under an electron microscope, it looks like a beehive. They're hexagons. And they're really, really tight so that they don't let irritants get through. Then underneath the urothelium, look at what do we have? We've got nerves and we've got blood vessels and we got mast cells down here. So this blue barrier, its purpose is to repel stuff and to make it difficult for bacteria to infect these cells. So if you, for example, were a big diet soda drinker, the acid of the soda is going to erode this blue layer. And so all of a sudden, irritants in your urine are now getting down here. They're reaching these cells. These are not passive cells. These are active cells. There's all sorts of really interesting communication channels happening. These cells tell your body that something is wrong, that something is here that shouldn't be here. So what your body does is it sends your fighters, it sends your white blood cells. Your white blood cells, the purpose of them is to defend you. In fact, on my Twitter feed, there's a great picture of this white blood cell chasing a bacteria. It's a great, I mean, real time. And white blood cells don't have eyes. It was chasing it through the bacteria was leaving a chemical trail, and the white blood cell was chasing it, right? So here we have a damaged bladder wall, irritants. It could just be, a byproduct of you walking by a smoker, or again, you drinking coffee or something like that, or just some sort of chemical that you were exposed to that ended up in your urine. It's now in here. And so your body's going, uh-oh, help us, there's an invader. And so up through your blood vessels come white blood cells, but these are capillaries and they're stuck in the white blood cells, right? I mean, they're stuck in the blood vessels. So what happens is the capillaries open and release them. They release them into the tissue. And when that happens, not only are white blood cells released, but also red blood cells released. And that's why we often have microscopic blood in our urine. It's just so you could just be having a flare. You could have drunk the wrong thing. It could have irritated the tissue. Here we go. We've got something that doesn't belong in here. Your body sends white blood cells into the area. It opens up the capillaries. Bam, that's that little bit of red blood cells in your urine combined with white blood cells. That's just your normal body fighting process. If you had visible blood in your urine, that's a whole nother story. If you're peeing blood, you have a pink toilet bowl, or you passing blood clots, that means something's actively bleeding, and that is an emergency. Excuse me. And so that's always a phone call to the doctor or a visit to urgent care. If your toilet bowl is filled with blood, you better damn well get on the phone and call your doctor right away. And or get to the emergency room, because that's not normal. We have to figure out what's bleeding. Is it your kidney that's bleeding, or is it your bladder wall that's bleeding? Bleeding often happens with infection. If you've got a really, really wicked infection, what that means is that the infection has basically worked all the way through this layer of cells and has now reached blood vessels. So you've got now a profound infection. And that's serious. That's pretty serious. The other time we see a lot of blood in the urine is with cancer, bladder cancer. And so, Barbara, what they can do is a very simple urine test called a urine cytology test. You just pee in a cup, they send it off to the lab, and that looks for cancer markers. Almost all of us have already had that done. That's part of the normal workup. So the odds are you might have already had that done. But if you have not had that done, ask them to do a simple urine cytology test. And the proof is in that data. If that finds some cancer markers, then they're going to want to look in your bladder and look a little bit further. The number one cause of bladder cancer is smoking. If you smoke cigarettes, or you live in the household with somebody who smokes cigarettes, all those tens of thousands of toxic byproducts, those carcinogens that you're breathing in through secondhand smoke or firsthand smoke, will end up in your bloodstream. They get pulled from your lungs into your bloodstream. Then your body tries to dispose of them through your kidneys. So those end up in your kidneys. They end up in your urine. And the hardest part is if you're older and you've got estrogen atrophy and you're still smoking, you're a fool. Because with estrogen atrophy, you don't have a lot of coating here. And so these carcinogens are now sitting on these cells where they can cause these cells to become cancerous. So it's very, very, very important for anybody out there who's smoking, especially as you're getting older, man, you got to stop it. Bladder cancer can be an easy cancer to treat if it's shallow, if it's only in the bladder wall. But once it starts getting into the bladder muscle, you're looking potentially at bladder removal. The other thing that we sometimes see is bladder cancer associated with HPV infection. I had one of our members she was only 31, 32. She had urethral cancer from HPV, the virus, and they ended up having to remove her bladder and a total hysterectomy and her urethra to save her life. So, you got to act when blood. It's important to ask these questions. The other thing that I found absolutely stunning was a study on the children of smokers. And the children of smokers, it is common for them to have the symptoms of frequency, urgency, pressure, pain began because of the irritants of the smoke affecting their bladder. So imagine having a 1-year-old, a 2-year-old, a 5-year-old, a 10-year-old in a home with a heavy smoker. The research proves that they are exposed to the same carcinogens and can easily develop the symptoms that you associate with IC. So we have to stop smoking to protect the children too. Krista says, my IC's flared up right now. I'm getting over UTI. I had to take 2 rounds of antibiotics. Calming and soothing is the way, plenty of water. You might find, again, one of the supplements that can help coat your bladder might be helpful. You kind of have to ride some of that out. Maybe the Azo bladder pain relief tablets would help to numb your bladder wall. These. Infections are tricky right now. Some infections, E. coli infections, are very, very difficult to kill. We also have to clarify the type of infection, because while you might think you have a bacterial infection, it could easily be a fungal infection or a viral infection. And so having a next generation urine test will help solve that mystery. Barbara says, no visible blood at all. Urine is a clear, light, wheat color. That's good. That's very, very good. But still ask, listen, my first year, I was obsessed with cancer. I could not believe that this was not cancer. I could not thinking about it. I thought I was dying of cancer. And I finally just poured it out to my doctor. And I just said, listen, I don't believe you. I think I'm dying. I think I have cancer. There's nothing but cancer that would explain this pain that I have. And he did the cytology test. It's fine. And then I demanded exploratory surgery. I mean, that's how convinced I was of it. And I had a laparoscopy and woke up in the recovery room. Jill, it's not cancer. Your bladder's actually fine. 30 years later, or 27 years later, now we know what it is. And that is that I am IC subtype 5, central sensitization, chronic overlapping pain conditions, and in all likelihood, small fiber polyneuropathy, which is the foundation for that. So, we have answers now that we didn't have before. We have the science now that's helping us understand you didn't cause any of this. None of this is your fault. There is no shame. There is no blame. I don't want anybody believing that they did something wrong or that they're being punished or that they're damaged goods. Hon, you're hurt. You're no different than someone who got hit by a car. You got hurt. Only you got hurt in your urinary tract or in your nervous system. And you deserve care. You deserve love and care. We deserve therapy. I don't want you hiding at home. I don't want you sitting in a dark bedroom with the drapes closed, not interacting with people. Come on, get yourself up, kick yourself in the butt, get back to the doctor, and let's try to figure this out. And again, this book is the book. This book this has chapters on orthopedics, on muscles, on GI problems and how that can cause pelvic pain, on bladder problems and how that can cause pelvic pain, on sexual issues and gynecological issues, and for men, testicular, scrotal issues, things like that. All those things which can cause pelvic pain. We had that big study last summer that showed that 70% of the men with testicular pain had an underlying hip abnormality. It was never their testicles. It was their hip. It was their hip. They had an orthopedic muscle problem, bony structure muscle issue. The other thing And this has chapters on medications used for pain, on diet, physical therapy, diet, how to get support. I wrote the chapter on how to get support, neuroinflammatory, vascular, rheumatological. There's a doctor out there who, it's always so interesting reading doctors' opinions. And I mean, now we know about the whole, again, the subtypes: Hunner's lesions, bladder wall driven, pelvic floor driven, pudendal neuralgia, central sensitization. And there's so many of you whose symptoms began after a muscle injury or a fall, right? If your symptoms began after having a baby or car accident, you fell on your tailbone, you were raped, you were an athlete, you were a cheerleader who did flying splits, a gymnast, an ice skater, or a dancer where you fell all the time, or you traumatized your pelvis in some way. We in modern humanity, we love our sports. We love to dance. What we don't necessarily, the Ironman athletes love to be on their bicycles for miles, thousands of miles over their careers. They love to run. They love to swim. What we don't take into effect is our body designed for that long-term repetitive workout? And the answer is no. And so what we start seeing are muscles responding to the strain. If you were a ballerina, you were taught to tuck your butt under. That's not normal. And as those muscles get stressed and tighter and tighter and tighter, we start seeing ischemia. We start seeing disruptions in blood flow. The bladder should normally get, I think it's 28 units of blood a day. There was one study that found with one condition, it was only getting 8 or 9 units of blood a day. That's not enough for the bladder wall to be healthy. So we had a doctor who said that he believed that a huge number of patients were just circulatory patients, that their muscles were so tight, their bladders were not getting good blood supply. And I agree with that. Every patient is an anatomical mystery to be solved. And we're no longer saying bladder therapies for everybody. We're no longer saying Elmeron for everybody. We're no longer saying diet for everybody. We can't have a good discussion about therapy until we understand your anatomy. And to understand your anatomy, go back in time and try to understand what could have been affecting your pelvis. So going back 10 years ago, 15 years ago, 20 years ago. And it's so interesting when you do that. Man, you guys are like, it's like trying to pull water out of a desert. When people call and they're asking for help, and it's like, okay, walk me back in time. Let's go there. Let's help me understand what's happening. And we can almost always find a trauma, especially in men, that there was some sort of triggering pelvic trauma. And so the latest one was a woman, and she had a bike accident. No. What was it? It was a hurdle accident. She was a hurdler in high school, and she was jumping across a hurdle, and she fell, and the hurdle went right up between her legs, right to the right or to the left of her vulva. And it went really hard up in there, massive compression injury, and then it cut her. And she bled profusely through this wound. And they had to go in and stitch her up, and I mean, it was a really bad, penetrating injury. And her symptoms started within a year. And she never thought of that. She said, yes, that I was young, I healed. And I went, no, there's a legacy to that injury. The legacy to that injury is we have weakened muscles. We might have scar tissue. We might have tight muscles that could be playing a role in this. And the piece that she missed in all of this as she was doing her bladder therapies, she never told anybody about that injury, and she never had a pelvic floor assessment. And that's what I said. It's time to have a pelvic floor assessment, and let's see if we have a legacy from that injury. It's amazing the number of times we find that. So anyway, All right, you guys, listen, we've been going for 3.5 hours. So I think, you slowed down. I've slowed down. So why don't we call it here for Facebook? I apologize for the screen quality. I do not know what's going on with that. I will call Comcast again. And I will probably log on again just with Facebook this week to test it out one more time, maybe even Tuesday. And let's see what happens. So in the meantime, I wish you well. Remember, sale on the IC network, spring 15% off all of your purchases this week. So please feel free to go on over and use that. I wish you well, everybody. This is a new hug. Hugs. And if you need some help, feel free to give me a phone call. All right, 1-800-928-7496. Mondays are my day off, and I'm supposed to be getting my new front teeth tomorrow. We'll see. This is the 5th time they've tried. These are temporaries. So I cracked my teeth in December. So wish me luck. I mean, like, seriously, I need luck because it didn't go well. They're kind of mad at me, and I'm mad at them that we haven't been able to fix this. So I'll see you later. Have a good one. All right. Goodbye, Facebook. All right, YouTube. Big hugs to you all. I'll see you later.